Thank you very much. Good morning. And just to inform you, we'll begin in just about 30 seconds. Okay, so in the next 30 seconds, we will begin the program. Thank you very much, and good morning, everyone. Welcome. We have Permanent Secretary in the Ministry of Health, Ms. Naomi Jeremiah, Ms. Fiona Anthony. She's the PAHO representative here in Grenada, Country Program Specialist. We have representatives of the Alliance of Evangelical Churches and the Conference of Churches, our stakeholders, consultants. We have viewers and listeners. Welcome to this national consultation for the development of the Health National Adaptation Plan for Grenada. We have had a number of other consultations along the way in this process, and today it's the national consultation, and we want to thank you for joining us wherever you are this morning, those online, and for those here in the room, we thank you for joining us. We look forward to a very productive session today. As we begin, let's stand for the opening prayer. We call Reverend Joachim Philip for the opening prayer, and after that, we remain standing for the national anthem.
Pleasant morning. Let's pray. Father, we are indeed grateful. We thank you for today, for this is a day that you have made. We make a choice to be glad in it. We ask for your presence for the day, that God, as we discuss things that are important to you, the climate, our health, and our Caribbean region, and Grenada, we ask for wisdom. We ask that you will grant unto us, Lord, designs that will help us for many, many centuries to come. We pray, God, that today will be fruitful. All the discussions will be a blessing in the end. Our generations will thank us for what you would do with us today. In Jesus' name, amen.
Thank you very much. Let's remain standing for the national anthem at this time. Thank you very much. You have your seats at this time. And this morning we have representatives from several sectors and several organizations, and I know that we will have very fruitful discussions today, and at the end of the day, we will have some significant recommendations as we proceed with developing the Health National Adaptation Plan for Grenada. We have our consultants. We have Mr. Leon Charles, lead consultant, and Dr. Lindona Glasgow. All right, she is the co-consultant, and so Lindona Telesford. My apology. Yes, Lindona Telesford. My apology. She's co-consultant, and so we will continue this morning. Our opening ceremony will be brief. Normally, you go to some events, and the opening ceremony is very long, and then you have little time to do the work. But this opening ceremony this morning will be very brief. So I now ask Mrs. Naomi Jeremiah. She's the Permanent Secretary at the Ministry of Health with responsibility for the strategic and operational management of the general and subsidiary hospitals, to come and make brief remarks at this time. Mrs. Jeremiah.
Pleasant good morning. Thank you very much to one and all. Thank you very much, Master of Ceremonies, Dr. Terence Walters, and Chairman of this workshop. I'd like to extend a warm welcome to this very important workshop on developing a Health National Adaptation Plan. To the head table, we have Ms. Fiona Anthony, and she's the Country Program Specialist, POWER, WHO. And we also have Reverend Philip with us. We like to also welcome him. And to our consultants, Dr. Telesford and Mr. Charles, we welcome you. And to, I see Dr. Noel and other stakeholders and organizations, we are indeed happy that you have taken the time out to participate in this very important initiatives. As we can see locally here in Grenada for the past weeks and days, we have been experiencing extreme heat. And the person's been wondering, well, what is really happening? And it's all about climate change. But we at the Ministry of Health have already taken up a number of initiatives to address this very important agenda that will impact all facets of society. And it is key that you should know that we have not sit down and just let things happen. No, we have already launched and initiated some smart hospitals at Princess Royal, Hillsborough Health Center, Richmond Home, the Central Health Medical Stores. We have also initiated some smart hospital systems there that can be resilient to the impact of climate change. It is indeed our agenda to ensure that our citizenry are safe and we are well and we are able to combat what is happening internationally, locally, and regionally with the health system. So I thank you for coming here today. I thank you for taking the time off, and I know that we are going to have a fruitful engagement with this agenda at hand. So to one and all, I say welcome and do enjoy the sitting. Thank you.
Thank you very much, and I promised that the opening ceremony would be short this morning, so we continue. Now, Ms. Fiona Anthony, she's the Country Program Specialist, PAHO WHO Grenada, and she has been doing a lot of work with the Ministry of Health, and sometimes she does not know this. I call her Wonder Woman, right? Ms. Anthony does not know this, but she is really good. If you have any any issues, any challenges, and you go to her, she will definitely find a way to ensure that you overcome those challenges. So let me welcome Mrs. Fiona Anthony to give some remarks at this time.
Good morning, everybody. And just like to say thank you very much to Dr. Walters, Masters of Ceremony and lead on this initiative and project, for his good words. And I also extend thanks to him as well for his great support, not just in this area, but in many areas where he's working with us in the Ministry of Health. So I'd like to welcome you all. I'd just like to acknowledge PS Naomi Jeremiah, PS with responsibility for hospital and community services, Reverend Philip, and again, Dr. Walters, and also acknowledge Dr. Noel in the audience, as well as Dr. Ford, who I'm seeing for the first time in person. And welcome to all persons here, including our facilitators. We have Mr. Leon Charles, Dr. Linda Doney Telesford, and all representatives from the government, private sector, and also NGOs. So it is a great pleasure for me to be here this morning on behalf of Dr. Amalia Darrego, who's the PAHO WHO representative for Barbados and Eastern Caribbean countries, to deliver some brief remarks this morning. As a small island developing state, vulnerable to the effects of climate change and natural disasters, Grenada is part of this initiative through PAHO with its collaborating centres and relevant agencies to support the development of Health National Adaptation plans in the CARIFORUM region. The project, titled Strengthening Climate Resilient Systems in the Caribbean, is aimed at developing the HNAP plans and also the development of concept notes for funding from the Green Climate Fund. Grenada has participated, as PS would have highlighted, in a number of initiatives, and it was identified that there needed to be an overarching plan to bring all of these initiatives together into one common initiative. So this is what the HNAP is aiming to provide. The process commenced in 2021 and is being led, as we've mentioned, by Mr. Leon Charles and Dr. Lindoni Glasgow, and also supported locally by the multi-sectoral HNAP committee. We are now in the stage of seeking engagement from stakeholders, which is why you've all been invited here today to get your inputs into the development of the HNAP. We commend the Ministry of Health, Wellness and Religious Affairs in being part of this regional project, and thank you all the participants for taking the time to be here today. We look forward to the outcomes of the discussions as we look towards strengthening the climate resilient systems in Grenada. Thank you very much.
Thank you very much, Ms. Anthony. And so we've come to the end of the opening ceremony. I did promise you that it will be very brief. Yes. So let me say thanks. We were supposed to have someone else doing the vote of thanks, but I'll jump in. All right. So thanks, Reverend Philip, for the opening prayer this morning, and thank you to PS and Ms. Anthony for your remarks. And I want to thank you for being here this morning. We know many of you have some very busy schedules, but you've taken the time to be here with us today, and we look forward to your contributions and the rich discussions that we will have today. Thank you very much. So, thank you. So now we will move right into the presentations, and we will just take 2 minutes to ensure that we have the screen and so in place, get the presentations up, and we would move right into that. And we'll allow the head table to take the departure at this time. All right, thank you once again. And so we've just completed the opening ceremony, and we at this time want to recognize those of you who are online, either via Zoom or by YouTube. We recognize those who are joining online, and we trust that you will glean quite a lot of information from the presentations and discussions today. So at this time, I'll just do a brief overview of the HNAP process and what is happening. All right. All right, thank you. So I got this, yeah? There we go with the technology. So a bit of context as to what we're doing here. So programming on health and climate change, it's not new in Grenada. We've been involved in quite a number of initiatives, and so I say that it's nothing new. We have had in the past 5 years the PAHO Smart Hospital, so we've been looking at upgrading and smarting the facilities as it relates to adaptation to climate change. Then the Caribbean Action Plan on Health and Climate Change, I guess that was an initiative that Grenada participated in recent years. And health and climate change is featured in the National Sustainable Development Plan 2035. So Grenada is no stranger to the whole issue of climate change. Caribbean health systems, we understand that they're challenged by scarce resources, limited human capital, and we hear of the challenges. We hear governments across the region talking about the scarce resources and the limited human capital. We understand that there are quite a number of our citizens who are working and living elsewhere when we would have liked to have them living and working here, right, in the region. But that's just one of the challenges that we have. And there are times when we see many of our healthcare professionals moving out for various reasons. Okay? The Caribbean health systems, again, vulnerable to the impacts of climate change. So our facilities, we're quite vulnerable. To the quality and delivery of healthcare services would be impacted by the challenges that we face. And so the national socioeconomic development is impacted. So lost work capacity, climate change, issues related to climate change, okay, can result in lost work capacity, reduced labor productivity. So when you have issues related to climate change, resulting disasters, various hazards, and so you can end up with reduced labor productivity. And then you have additional burdens placed on health insurance. So this whole issue of risk transfer, request for risk transfer in terms of health insurance, that's a burden that we're faced with, and it's all because of the whole issues with climate change and the health systems and how they're impacted by issues related to climate change. So the National Adaptation Plan, right, because Grenada is currently doing its National Adaptation Plan, and the Health National Adaptation Plan is feeding into the national plan. So there are many countries that are currently developing their national adaptation plans, and Grenada is updating its plan. The document should be comprehensive and should focus on many sectors, or not just many, but all sectors, because it is, all of this has to come together to ensure that as a country, okay, as a country, we look at the issue of climate change in a comprehensive manner. Health should be integral, so that's why we're doing the health component of the plan, the HNAP, and then the health component should be driven by the health sector. Driven by the health sector with the input of national stakeholders like we have today. So it's not just the health sector alone sitting down and doing this plan without the input of the other stakeholders. But we understand that the wider society and all the stakeholders need to be involved and give input into the development of the Health National Adaptation Plan and the HNAP. So benefits of the Health HNAP, you have engagement of the health sector, health planning, with non-health sectors. You just mentioned all of the stakeholders. So that's one of the benefits. So you get people to give their ideas, their opinions, things that you may have overlooked. All right, the other stakeholders will be able to provide those ideas. So prioritization of public health threats, that's one of the other benefits of the HNAP. You're able to analyze the effectiveness of public health programs, policies, and various plans. So you have to do the review. There are times when we have policies and plans that we've developed over the years sitting somewhere. Nobody knows about it. And when you ask about it, nobody could tell you where it is. Nobody could tell you when it was approved or how long it has been approved, things like that. So the whole process, it gives you an opportunity to analyze the effectiveness of your public health plans, policies, and so forth. So that's one of the benefits of the HNAP. And then you are able to create projections in response to climate change. So we're looking at 10, 15, 20, 25 years down the line and making projections. So with the discussions, we can say, okay, in the next 30 years, in the next 50 years, these are the things that we will be seeing during that time. So these are the plans that we can make or should make at this time, and these are the policies that we should develop. And so I know Dr. Ford, people like Dr. Ford, yes, Dr. Ford, I know you have been integral in a lot of these. So yes, all right, those are the benefits of the HNAP. So the project is called the EU CARIFORUM Strengthening Climate Resilient Health Systems Project. That's the name of the project under which this falls. And the project supports countries in the preparation of their Health National Adaptation plans. Okay, promotes engagement of health sector with other national partners. We mentioned that earlier, bringing in all the stakeholders. So there's that engagement. Capacity building, okay, capacity building in the health sector and other sectors. Then there's a systematic process that is followed. So it's not just you wake up one day, you have a workshop, and you just put together a plan, but you have engagement. So we've had engagement with the Ministry of Health at different levels. We're having engagement with stakeholders today. We've had engagement with the HNAP committee, which was established by Cabinet. So we're having various engagements to ensure that we capture as much as possible. Right? We want to capture as much as possible so that the document, again, would be comprehensive. And it supports efforts to reduce vulnerability to climate change impacts. And we understand that climate change, again, is real. There will be impacts, and we have to reduce vulnerability. Do whatever is necessary, whatever we can, to reduce vulnerability of the population. And then efforts to mobilize finance for sector interventions, and the consultants will talk a little bit more about that in terms of mobilizing the finance. These are the participating countries, okay, in the project we spoke about earlier on, the participating countries. So the HNAP committee, which I mentioned earlier, was established by Cabinet, and the composition, you have Ministry of Health, Finance, Statistics, Ministry of Agriculture, Tourism, Climate Resilience, NADMA, the Met Office, WINDREF at SGU, and NAWASA. That's the composition of the HNAP committee, which was established by Cabinet. So the consultant, as we mentioned, all right, Mr. Leon Charles is the lead consultant, and the co-consultant is Dr. Lindona Telesford. I always pronounce the name Lindon, right? But it's Lindona Telesford. The process started in August 2021, and we had the technical review of all the available information related to climate change and health. So there was a technical review, and these 3 documents, the SWOT analysis, the report on the risk of climate-sensitive outcomes for the health sector, and the assessment of the future climate change impacts on health in Grenada. So those documents, after the review, these 3 documents were produced. Some of you have the documents. If you require those documents, the additional 3 documents which were referenced in the concept note, we can make them available to you. So the findings of the report, we summarized it and presented the consultation document, which everyone received. And I hope you were able to read the document in preparation for the consultation this morning. So the objectives, we have to share information, okay, to propose adaptive responses to the challenges and gaps identified. So we're going to share information, some responses to the challenges, and then prioritize areas for immediate action and inclusion in the concept note that will be developed and submitted to the Green Climate Fund for funding. All right, so there's the opportunity after this process that we can submit some proposals for funding, and hopefully we will be able to access some funds that will finance some of the measures that we want to take here in Grenada to combat the whole issue of climate change. Great. And I think I've come to the end. Okay. I think we've made it to the end of this presentation. So thank you very much. Thank you very much at this time. Okay. All right, so now, in terms of questions, what I'll do, I'll turn over, because we get a chance to ask questions and all of that a little later on. I'm going to ask now Mr. Leon Charles to come and continue with the next presentation at this time. Mr. Charles.
Okay, thanks very much, Dr. Walters. And let me join in saying good morning to everyone, and to thank you for sharing with us, making the sacrifice to share your day with us. We hope that by the end of the day, you would have found it a day that was well spent. I want to pick up from where Dr. Walters left off, provide a little more on the context of this process, because I think it's important to understand how far we're trying to go with the HNAP, given that we have a tendency in the region to simply do these kinds of processes and then put a document on the shelf because we have a nice document. And this process is aimed to go much further than that. So I want to spend a little time on this. Then I want to talk a little bit about the implementation process we're using. It's no accident, for example, that everything you see is coming through the Ministry of Health and not coming from me as the project coordinator. Because it's important that the project, the process, and the outcomes be owned and implemented by the ministry. So as a major principle in terms of how the project is being done, the ownership and leadership of the ministry is at the forefront, and I'll come back to that in a couple of minutes. A quick summary of what we've done so far, and then we'll talk about the consultations. The key findings from the diagnostic phase, Dr. Telesford and myself will share the presentation, so I'll do some of it, she will do some of it. And then we want to talk about what we want you to address today as we go through the rest of the day. Your job really is to take us to task and see if there are any gaps, for example, in the work we have circulated. Is there anything you think needs correcting or anything that we've missed? And then, most important, right at the end, we need to get your ideas for how can we make the sector resilient to climate change. So we'll walk through it together. We have quite a number of people here. I think the last count I had was 27. It's probably a little higher than that right now. We had 50 confirmed, so we still may see a few more people coming in. And hopefully together we can come up with an outcome that we all will be happy with. So in terms of context, as I said both by the PAHO rep and by Dr. Walters, this is a regional project. And 16 countries are signed up to the project. 8 countries are right now in the process of developing the HNAP. And one of the beautiful things about this project is that the countries are helping each other. So we have what PAHO called a technical working group, which meets once a month, where we update each other on the progress we have made, the challenges we've had, how we've overcome the challenges, and so on. And the idea being that at the end of the project, the region, as a region, you remember Dr. Walters spoke about the Caribbean Action Plan, the region together will be moving forward on addressing the impacts of climate change and health. So it's not an isolated project, it's a regional project with quite a bit of regional support in this regard. And one of the things PAHO is trying to do is to ensure that not just the project developers, but also the support activities that are going to be required to implement the project is also being done regionally. So for example, I think this week or next week, they'll be having a meeting with all the communications personnel in the different countries to begin to talk to them and to work out with them how do we begin the public education and public awareness component of what's going to be required in addressing climate change and health. So it's a broader project we're contributing to, and therefore I want to make it clear that you will not be wasting your time in terms of a document going on the shelf. The other important thing is implementation, because implementation requires money. And I don't know how many of you have heard the term Green Climate Fund. It's been bandied about quite a lot. It's a financing institution for climate change that right now, for example, is financing the development of the water sector in Grenada, where we have a $140 million project going into strengthening the ability of the water sector to respond to climate change. One of our mandates to this project is to develop a concept note for funding based on the findings so that we can submit to the Green Climate Fund, hopefully so that we can then develop a full project proposal for financing. So we're not just walking to the point of producing a document which will go on the shelf and say we have a nice plan, But we're actually working to the point where we're going to, out of this project, make a submission for funding to the Green Climate Fund. The way they operate is, once they get a concept note, they will review it, and if the concept note is approved, then they'll give you support to develop a full project proposal, which is what is then funded. So there are a couple of steps down the line, but the point is the concept note is a technical document, so we're not going to leave the ministry with a plan that says you should do this, but we're going to leave them with something that says we want some funding to implement, and therefore hopefully the project will go further than just being a nice document on the shelf. So I think it's important to understand that. Concept notes will be developed for 5 countries. To see that Grenada is one of the 5. Bahamas, Belize, Grenada, St. Lucia, and Trinidad and Tobago. So we're in a good space as regards this. What we need to do is come up with something that is really robust and that's really going to make a difference for the health of our population in the face of climate change. So I wanted to just emphasize these elements of the context, that you're not wasting your time here today. That what you're doing is really contributing to a process that hopefully will deliver very positive outcomes in the face of the threats from climate change. Now, the implementation process of the project is informed, as Dr. Walters said, led by a HNAP committee, which is led by the Ministry of Health. A lot of the work which you have done so far has been following methodology and guidance from the WHO, because they actually have a very extensive library of methodologies for addressing climate change. So we've been following the methodologies and the guidance, and the documents you have seen, the 3 documents that have been mentioned early on, were all done based on the WHO guidance. Among them, they have what they call quality factors which need to be addressed and building blocks of a health system. Then we've also done a detailed literature review. We've probably consulted over 40 documents based on what's available regionally, locally, and internationally in terms of climate change and health. And we've supplemented this by actually working with individual targeted stakeholders in the Ministry of Health. So for example, the Chief Medical Officer was a part of reviewing some of the documents. The Planning Officer in Health has reviewed some of the documents. And last week, we had 2 rounds of consultations with the ministry. We met with the senior policy team in the Ministry of Health, all the top officials. We met at a policy level dialogue on climate change and health. Lasted the whole morning, actually. And then following that, we met with the people who are at the forefront of the delivery of health services. So the community health nurses and so on. We also met with these people. So what you're getting today and what you're working with has been informed by all of these inputs to date. We also mandated to submit whatever comes out of this project into the National Adaptation Plan. We're very fortunate in that the National Adaptation Plan is currently being updated. So we're very, very much on time for getting involved into it. And I hope Diane doesn't mind me saying that we have with us this morning the consultant who is actually leading on the development of the NAP. And it's good to have her here so she'll hear what your suggestions are and understand why the recommendations we make are being made. So we also have that opportunity. And that gives the health sector actually 2 angles to work from on implementation. Because we'll work angle 1 through the PAHO process and the concept note process and the CARIFORUM process. But we'll work angle 2 through the NAP process, because once the NAP is finished, the government is going to try to source funding for the implementation of the NAP elsewhere. So we have that opportunity on both angles to really make a difference in the health sector. And I know that health is a priority in this country across a number of different dimensions, and therefore it's an opportunity to try to move it forward like that. In terms of the quality criteria, which we have had to follow, just run through it quickly. 1, we had to ensure that the leadership of the process resides with the Ministry of Health and not with the consulting team. So we are supporting health. Health is leading us. And Dr. Walters is the contact person in health who is responsible for coordinating what happens with this project. We also need to ensure that there is cross-sectoral coordination and policy coherence, because there are a number of non-health things that affect health. For example, the quality of your water affects health, food security affects health, etc. And this is one of the reasons why we have you here today. We've tried to invite people from all different sectors. And when we come to the breakout groups, you'll see one of the questions we're asking you is what projects are happening in these non-health sectors that we need to be aware of, because they affect what happens in health. So it's an important pillar of the work we're doing that we have cross-sectoral coordination. And to facilitate that through every step of the process, the government has also set up a multi-sectoral committee called the HNAP committee, which Dr. Walters showed you the representation from a number of different agencies, all of whom would contribute to advancing the health sector. Then we're mandated to do a comprehensive coverage of climate-sensitive health risks. So again, that's one of the reasons we have all of you here today. We want to not only get it from health, but hear what you are seeing from your health perspective. But while you may not be health experts, you're experiencing health. And therefore, what are the things you're experiencing from a health and climate perspective that you would like us to address in the plan? We want to get that from you today. You spoke about the heat. What is the heat? Who is the heat affecting? How is it affecting you? What do we do with it? The whole question of hurricanes and so on and the impact on the health sector. The opportunities in the health sector for renewable energy through your transportation and your equipment and so. All of these we want to pick up coming from you as non-health people. And then we want to come up with adaptation options. What do we do in response to these threats to the health sector? And I'll come back to that when we come to the breakout groups. And then I spoke about resourcing already, the question of financing. We also mandated to look at what is called the building blocks of the health system. And this is a PAHO structure that there are 6 building blocks which every health system should have and therefore which we should address. 1 is health service delivery. 2, the health workforce. Do we have the manpower, the resources, the skill sets we require? 3, the information systems, the surveillance, the data on what is happening, where it's happening, and so on. 4, access to essential medicines. 5, the health system financing. And 6, leadership and governance. And if you think through the issues you see us raise in the consultation document, you would notice that all of these 6 building blocks have been addressed. So I wanted to give you the frame so you understand as you get into your discussions what it is we're trying to achieve and how we're going about doing it. To date, we've done the baseline reports, which have been mentioned already, which have been reviewed by the HNAP committee and by PAHO. And we know at the level of the consultations with you. Once we finish this round of consultations, we will develop a full comprehensive list of all adaptation options that have been proposed. And then we'll work with the intersectoral committee to prioritize them into a list that's going to go into the NAP, that's going to go into the concept note. They may not necessarily be the same. And that's going to also be there as a subsidiary list in case other opportunities come up. So that's how the process goes forward from here. And then out of that, we'll come up with the final versions of the HNAP. So what we want to do today is to get your feedback on what you've read so far. I hope you've had the opportunity to read the documents. We deliberately gave you the consultation document first because we were worried if we give you the 3 technical reports, you might have felt overwhelmed. And then we gave you the opportunity, if you wanted to request the technical reports. I must say I was pleased to see that a number of you requested the technical reports, and I hope you found them useful to read also. So we want to get your feedback on them. Is there anything in them that you don't agree with? Or is there anything missing we need to add? And feel free, please, to take us to task. We're very open on that one. Secondly, we want you to propose responses to the challenges and the gaps so that we can include them into the HNAP and the NAP. And thirdly, we want you to identify what are the things you think we should put to the concept note and why. What are the priorities for the concept note? So we'll do that after Dr. Telesford and myself has finished presenting the information. We're going to then work in small groups. We've schedule 1.5 hours to 2 hours for small group work because we want to make sure you get an opportunity to really grapple with the material. So that's where we'll get into the details of what your proposals are. So that's where the project is and where the project is going. Probably before I start into the technical findings of climate change and health, just like to open the floor for a couple of minutes in case anybody has any questions on the process. What we're trying to do, how we're trying to do it, where does this consultation fit into all of it? Are there any questions? Just show by a raise of hand. Terry, use the microphone. We have a question in the back. Okay, and if for the record, you can identify yourself when you're asking questions, it will be helpful. Thanks.
Okay, good morning, everyone. My name is Silbert Prescott, Conference of Churches. Just two things came to my mind as I listened to the presentation this morning. I didn't really get a chance to go through the documents, but I think two things came to my mind as I listened this morning. One, the composition of the HNAP committee, which was approved by Cabinet. Looking at the committee, for me, I noted it is comprised of persons from Ministry of Health, Finance, the Met Office, NADMA, NAWASA, and those national agencies. So my major concern in that regard is that where there's no NGOs or those kind of groups represented in that kind of in that makeup. So that's the first concern that I had basically. And secondly, I noted that you said that the HNAP committee, you are following guidelines laid out by the WHO. The challenge sometimes with these kind of is that sometimes the a lot of the policies that outline probably projects, how can persons access projects? I think because they are drawn up by agencies outside who perhaps don't really have a full grasp of the realities that we face, particularly in these small islands, is that very often you find that people don't really apply, people don't get a chance to, even though they have projects, they don't have a chance to access the funding because of sometimes some of the stringent policies that they have to kind of meet in order to access these funding. So my concern is that what contribution or how can, what contribution can we make as perhaps Grenadians, as people who are on the ground, to perhaps these kind of policy and setting and so on.
Okay, thanks very much, and thanks for two very, very good questions. On the first one, the composition of the HNAP committee, I think when it was done, the idea was to include the entities which had a direct impact on health. So you worked with agriculture through food security, you worked with NAWASA through water, the Met Office because we needed the data for the surveillance systems and so on. And therefore, the NGOs were not considered there because it was a technical committee which would look at the impacts on health. We're open if you think there should be a recommendation for an NGO to be brought on. Sure, we can consider it. We'll have to come up with a criteria, to decide which is best to select. But that was really the thinking, that it was a technical committee with people working in sectors that directly impacted on health. So that's your first question. Your second question on the WHO PAHO guidelines and so on. You recall I said that we have all the countries working together, meeting on a monthly basis to exchange information, discuss challenges, look at how they have adapted to the challenges and so on. And it's precisely because of the point you raised that that mechanism has been put into place. So that if something that is proposed in the guidelines needs to be tweaked, we can discuss it on that level. How it has been tweaked in some countries will be shared, and then the rest of the countries will then move forward based on that experience. So by the sharing of the experience and the fact that we have 8 countries right now at some stage or the other of an HNAP, it gives us the opportunity to make sure that the local Caribbean flavor is captured in all of this. In terms of your subsidiary question, how can you contribute to this process? We're doing a very transparent process, as we said. We've deliberately brought you in here so that we can get your views because we want them. You would see that we've done a live stream which is going to be available after the process. And we will encourage you as stakeholders, once we've finished with this stage of the process, to remain engaged in terms of the publications and so which will be put out. Because the NAP, for example, is going to be having some kind of consultation at some point going forward. So you get an opportunity to contribute to the NAP. And then when we get to the final version of the HNAP, there would have to be some public unveiling, announcement. We haven't gotten to exactly what kind of event yet, which you will also be given an opportunity to be a part of. So there will be opportunities as we go along to keep the process transparent, to keep it consultative, to keep it inclusive, to keep it participatory, to make sure that all of you get an opportunity, everybody gets an opportunity to input into what's a national document. Okay, I think I saw Dr. Noel or Hayden's hands up. Microphone.
Yeah. Thank you very much, Mr. Prescott. Through you, Chair, I just wanted to note that WINDREF, who sit on the HNAP, is actually a 501c3 in the state of New York, a charitable trust in the UK, and is an NGO listed here in Grenada, Carriacou, Petit Martinique. Thank you.
Yeah, I was selected WINDREF because they're doing direct working research. That's what I said. We're looking for entities which are directly involved in the interface with.
Good morning, everyone. Hayden Redhead. I am the program manager at WINDREF. My question is it the intention that the HNAP would remain a supplementary plan under the NAP, or is it the vision that it would exist in its own right at some stage?
Okay, thanks very much. Good question. You recall I said that health has 2 angles to work from. One angle is that it's going to be continuing working through the PAHO process. And in that context, it's going to be a document in its own right. However, because the HNAP is also part of the National Adaptation Plan, then it's also going to be involved in the NAP as one of the chapters. But I also made the point that what's in the final HNAP may not be the same thing as what goes into the NAP, and may not be the same thing as what goes into the concept note. So we basically would have this big matrix of activities, actions that needs to be done, and then we'll position them in the various documents depending on their objectives, their scope, and so on. So it gives us an opportunity to work from both angles, although there will be commonalities across a number of them. Okay? Thanks. Question?
Morning, everyone.
Yeah, we're hearing you.
Morning, everyone. My name is Sonia Nixon, and I'm representing the Cancer Society and SADO. So I have a little abyss in my mind. I believe that when we develop projects that are going to be of national importance, that there must be some constant engagement of the population. And I tend to agree with Reverend Prescott here because I don't feel the people in this. I also don't understand how you're going to keep people engaged over the period where you develop and and even when you want to implement. I'm a little lost here. I mean, there's been a lot of details shared this morning, but I'm a little lost, and I'm afraid that it's going to end up on the shelf, like a lot of things do in the Ministry of Health.
You're afraid?
It may end up on the shelf, as a lot of things do in the Ministry of Health. This is actually very crucial. You know, I stood out there, I went to take a phone call. I went to Heinz School, I went to convent, right? And I lived in St. George's all my life. And I looked at the sea at this time, bashing into Cherry Hill. And I felt like it was falling down. This is something I'm accustomed to, something I'm accustomed to. I'm really concerned that we're leaving out the people, the people, me, you, Linda, on the people on the ground. I feel an abyss. You guys agree with me? I'm just being a politician here.
Okay. No, I think that's a very useful observation. And part of the answer will depend on how we design the NAP, the HNAP. I must say that in the discussion to the Ministry of Health last week, two things came out which I think are relevant here. One is the fact that they have to take the lead on this process, and it should not remain on the shelf, which is why we're doing the resource part of it through the Green Climate Fund. So PAHO isn't going to say, okay, you know of a document, you can go to rest, because they know the resource funding part of it. But alongside that, what has emerged from all the discussions is the need for ongoing public awareness and public education. That has been one of the emergent themes, and I expect that will come from you again today. And that public engagement and public awareness side of the NAP is what is going to keep the population involved as we go along. Because one of the things, and I'm jumping a little ahead but in answering the questions, that's going to become important, for example, are early warning systems and thresholds for heat alerts and those kinds of things. And for the public not to panic, there has to be a certain amount of general understanding of the problems, so when something is issued as an alert, you know how to respond and what to do and so on. So part of the answer to your question, Dr. Nixon, is that the process is going to answer, we come up with is going to answer it. But there is a recognition that the public has to play an integral part and therefore needs to be kept abreast of developments on an ongoing basis, because you never know when there's going to be a heat wave. You never know when there's going to be a hurricane. You never know when there's going to be a bad dry season, which is going to create problems with water quality and those kinds of things.
And there are going to be.
There are going to be many, as I'll tell you in a few minutes. Okay. Yeah, Doc, Shiragova, here. We're not hearing you, yeah. Okay, Terrence.
Hi, yes, I am a trainee. So my question, just to roll out of what Dr. Nixon said, is that, first of all, who are the drivers of the NAP? Is it the Ministry of Tourism, as mentioned in the SWOT for submission? Are they the drivers? Are they the owners of the document?
Are there any? Just repeat the last question.
Is the Ministry of Tourism, Climate Resilience and Environment, are they the drivers of the NAP?
The NAP?
Yeah, the NAP.
The NAP is the Ministry of Climate Resilience.
Okay, so which is the Ministry of Tourism, Climate Resilience and Environment. So they are the drivers, but the National Designated Authority will be the owners of the document, and would members of the HNAP committee be a part of that?
No, there are two documents, and I hope you're not mixing them up.
Okay.
One is the NAP,
Right.
which is the National Adaptation Plan, which takes in all sectors.
Right.
The other one, which is the one we're working on,
HNAP.
is the HNAP,
Yes.
the Health NAP,
What I'm
which is
saying
a
is-
chapter in the
In
NAP,
the-
but which is also a standalone adaptation plan for the health
Granted.
sector.
But what I'm saying is, would members of that HNAP team be part of the National Designated Authority and be responsible for assisting in driving the NAP?
The National Designated Authority, the NDA,
Yeah.
is an entity in the Ministry of Finance,
Oh,
which is responsible for all the national interfacing with the Green Climate Fund.
okay.
That's the sole purpose of the NDA.
It wasn't stated, that's why I asked.
Yeah, that's okay. That's why I'm asking you if there are any gaps.
Yes, so
So if you
page 2 on his SWOT
you,
submission.
you'll come back to that this afternoon in your breakout
No
group.
problem.
Make sure you record that aspect of it. Okay, so there are different entities with different rules, but the HNAP has to interface with the NDA because we have to come up with a concept note for the Green Climate Fund. So the HNAP will go through the NDA process. So, okay, yes, Dr. Nixon.
So I write because I forget. The first slide you did, Dr.
Walters.
Dr. Terrence, because I remember Terrence did this. Dr. Walters, the first slide you spoke about scarce resources and human resources. And you talked about limited human capacity, right? You didn't, I think we need, I'm just suggesting here, before we forget, because I might forget after, that we consider not only quantity. You know, we have a lot of doctors, and we have a lot of all kind of thing, but then you don't have different levels. So I want us to ensure that if we're going to implement this, that we don't only have numbers, because there are some numbers that are bad too, okay? And no, seriously, we have poor quality, and we have to ensure that we have quality of resource, human resource participants. And that's one of the things I'd like included in this.
Okay. I think we've begun to have a very good discussion, and that's a good sign for how things are going to evolve. I suggest we continue now with the technical part of the presentation so you can get a sense as to what the findings are. And then based on that, we can then begin to talk some more. Yes?
We have someone on Zoom with a question, Gerard Joseph.
Pardon?
Gerard Joseph.
Oh,
Yes,
somebody
one
on the
question,
Zoom has a question.
On
Okay.
Zoom, yes.
Okay.
So you can go ahead, Gerard.
Yeah, my question, can you hear me?
Yes, can I get a little volume, please?
Yes, go ahead, Gerard.
Okay, my question, it's piggybacking still on Sonia, Dr. Nixon's concerns, questions. Yes, interest from the public, but you have said you would, but you didn't highlight how. I'm representing MWAG as well as my media fraternity on this. So how would the public be engaged and be kept up to breast so that they can be involved, they can give their input, so this whole project can be successful and, as Dr. Nixon highlighted, not be something else that just would be ending up on a shelf someplace in the ministry.
Okay, the question of the how is something that is going to be developed as we move along. Our first step has been this stakeholder consultation, where we try to identify all the various civil society groupings, because we cannot just tell the general public, everybody come to our mass rally, let's discuss health and climate change. And I've not been facetious, but we cannot do it, so we have to do it through the organized structures. So one way is these kinds of consultations. As I said, it depends on how the NAP goes ahead with its consultations going forward. So there may be another forum like this when we have a final version, but I'm not going to make a promise on that. But that's one aspect of how it could be done. The other aspect is through setting up mechanisms where the public can call in or make submissions to the Ministry of Health and so on. This could also be done. And then, as I mentioned earlier on, public awareness is an important part of how the process will evolve going forward. So that as part of the public awareness programming, there could be things like community meetings, the word now is town hall meetings, they call it, and those kind of things. But those things will evolve based on the outcomes of, like today, what kind of activities we come up with, what recommendations come from stakeholders, and so on. So it's an evolving process, and we'll have to see how some of it comes out at the end of the day. I hope this satisfies you for the time being.
All right, we have Cassandra Mitchell. Please go ahead with your question.
Okay.
Thank you so much. Good morning, colleagues. Good morning, panel. Cassandra Mitchell from the Caribbean Association for Youth Development. I'm also representing the ICCR. I hear your responses to the concerns raised in the room about the inclusion or the lack of the CSO representative on the committee. We need to take into consideration that this initiative also focuses on SDG 17, which speaks to partnership for the goals. And this is more than just keeping us, the public, abreast of what is happening within the project. We continue to emphasize within the CSO community that we don't want to be rubber stamping any initiative. We really want to be part of the process. So I hear you. I'm reading the current representation on the HNAP committee, but this is more than just having technical expertise and speaking down, if I may use that term, to the public. We want to be involved. We believe that we have a lot that we can contribute. So I would like to see, as someone within CSO, a bottom-up approach included in this. Also, I haven't heard anything looking at the outcomes or the projected outcomes of this initiative, but any gender responsive strategies or mechanisms for achieving the goal. And I think that is really important. Thank you.
Okay, thanks very much. As I indicated early on, there will be efforts made to continue keeping the public abreast of it. We committed to a very inclusive process, and part of the process will depend on what comes out in the earlier stages. I hear the request for the HNAP committee to include a civil society representative. I said we already have no serious objections to that. The question is going to be what criteria we use and how do we select what that representative or who that representative would be. So it's something you may want to pick up a little later on in your breakout groups in terms of the governance aspect of the process. Okay, thanks. Any other questions on process? And I must say I'm pleased to see the level of interest. The challenge is always how do you capture it and how do you maintain it? And as I said, and that's why we felt that doing this forum today, where we brought in not the health people, not the technical experts, but people from the full range of civil society organizations, is one way in which we can keep it being inclusive. We expect that when you go back to your organizations, you will make reports to your organizations on what came out of this, and that way the information will disseminate through the membership in the organizations. Any other approach, we'll have to make sure that it is structured, and therefore any thoughts on how we can structure it will obviously be very welcome. But as I said, we cannot go and just have a big mass meeting and say, let's all go and discuss climate change and health. That's not a realistic, feasible option. And therefore, we need to find a way to keep it structured, at the same time, keep all stakeholders involved and included in the process. The question on whether the output will be gender mainstream, the short answer is yes. Everything we do now has to be done from a gender-sensitive perspective, and therefore that will be part of how the eventual document will be reproduced. Okay? Any other questions online? Okay, thanks very much. So let's continue now with the technical side of it. What have we found from the technical reviews so far? The first thing, I think all of you know that, so I haven't got to spend too much time on that, is that Grenada is experiencing climate change. We tried to work as much as we could with data and not just with opinions. The data we had available has shown that there has definitely been temperature increases, but you'll notice the period of time is 2006. So there probably would be even more. Now, if we had the data, the problem with our data collection in Grenada, as you know, is that it's not very comprehensive over the country. And a lot of the data we have here comes from the Met Office. In the last 2 or 3 years, I must say the Land Use Division has strengthened a lot the ability to cover the entire country. But for projections and conclusions and so on, we really need 5 to 10 years of data as a minimum. In cases of making definitive conclusions, you need 30 years of data. So while we now have a system in place to begin collecting the data, it's not data we can really use at this point. But the data that's available have told us that their temperature is increasing, and everybody talks about the heat. We know we can feel it when we go outside. Secondly, there are variations in precipitation patterns and amounts, and I think you're all so familiar with that. The seasons seem to have changed quite a bit, and one of the things that is observant right now is that when rain falls, even though it's in short showers, it's much heavier than it used to be. This is a direct result of the increased temperatures, and in fact, for every 1 degree increase in temperature, we get 7% more evaporation in the atmosphere. So we definitely would be seeing these variations in rainfall patterns and amounts. And then we've also seen sea level rise, an average increase of 2.9 millimeters per year since 2000. And in the Caribbean region, the projection is that it could be as high as 1 meter by 2100. So that's the first thing, and we don't think that's in dispute. Grenada is experiencing climate change. The second thing is that the impacts are expected to increase. And I think Dr. Nixon made the point we're going to be seeing a lot more of these kinds of things. And this is based on modeling done by different teams on what's happening in Grenada. And I just summarized it here. One of the documents has it in a detailed analysis of it. For temperatures, we expect to see increases in excess of 2 Celsius by the 2050s and beyond, unless the international negotiations are successful in limiting to 1.5 degrees. I don't know how many of you actually follow the international negotiations, but there is a major thrust on to try to get countries to take action so that the temperature increase over pre-industrial times does not exceed 1.5 degrees Celsius. Right now, we've already seen between 1.1 and 1.2. So we'll need drastic action between now and 2030 to get the increases staying within 1.5 degrees. In fact, we need to reduce global emissions by 50% of 2010 levels by 2030 if we have to have a chance of staying within the 1.5 degrees Celsius. Currently, based on present policies, that will not happen, so countries will have to make a lot more in terms of the actions they take to reduce greenhouse gas emissions. We're also looking at an increases in the frequency of hot days and nights. I think these are things you're already experiencing, the hotter nights, and the potential for an increase in heat. Again, we're already seeing that. Dr. Telesford, in fact, has done a heat impact study for Grenada, and when she comes to do the specific findings, she'll talk to you a little more of what the findings were of the heat and health in Grenada. It's pretty serious, is all I will say at this point in time. Rainfall, we expect to see decreases in annual precipitation by the 2080s, which is the reason why NAWASA got such high priority in terms of beginning to do the climate resilience work. And you may find it contradictory that we have decrease in rainfall while we have more extreme weather events. But as I said, the reason for that is that the increased temperatures increase the rate of evapotranspiration, and therefore there is more moisture in the atmosphere. So less rain will fall, but it will fall heavier. And if it falls heavier, you're looking at the potential for flash floods. So that's something we need to look at, because all of this has implications for health. We expect the intensity of the major hurricanes to increase, also for the same reason that with the higher sea surface temperatures, it's more fuel for the hurricanes, and therefore they'll be stronger. And then sea level rise is projected to be at least 1 meter by the end of the century. And I could tell you that that's a very conservative projection. We have done some work which shows that a 1 meter increase in sea level rise with no remedial protective measures on the coast could result in the loss of a number of our beaches, including significant portions of the Grenada beach. So the projections in terms of what climate change could do in Grenada are very significant. And that's where the full NAP comes in, because the full NAP will take in the other sectors, coastal zone, agriculture, food security, and so on, which we wouldn't be taking up because we're focusing primarily on the health aspect of it. So that's the second finding, that the impacts are expected to increase based on all model scenarios. The impacts basically with the hazards will become more frequent and intense, and this should be no surprise to most of you. We're talking about heat waves, we're talking about hurricanes, talking about droughts, we're talking about flash floods, and sea level rise. We also found that the health sector has already some experience in dealing with climate change, and that's important because it means, one, we're not starting from scratch, and two, we actually have some experiences we can treat as pilots and learn from, so we can have a step ahead of some other countries which has not really done much. There was the PAHO Smart Hospitals initiative, which supported interventions that strengthened a number of facilities, including some in Carriacou and some in Grenada. So that's one of the things that's going to become important. What worked, what did not work, what can we learn from that initiative? There's an OECS Regional Health Project, which is going to expand and refurbish health facilities in Sates, St. David's, Mongay, and so on, which are also going to be, again, good examples for us. It's going to strengthen the lab and strengthen the health information system. We have the water project, G-Cruise, which has a health component where it's working on increasing the water storage in 16 health facilities so that they can continue operations even in the event of an extreme event where water has to be shut down. And then we have the heat health pilot, which I spoke about a little earlier on. So these are things that are already underway. And therefore, it gives us a platform to learn from the experiences and come up with something comprehensive, which hopefully can benefit Grenada. Now, we've come up with some general conclusions and some specific conclusions. I will summarize the general conclusions, and then I'll hand over to Dr. Telesford, who will walk you through the specific findings. The first general conclusion is that climate change impacts are multidimensional, in the sense that it occurs across the spectrum of health systems. So it occurs in terms of the monitoring of new diseases, and then we'll talk to you about that. It also occurs in terms of what is done for management of diseases. It impacts on your health infrastructure, and it impacts on your governance because it puts additional emphasis on the need for bringing climate change into your policy level, for example, and how your overall governance of the structure is. So addressing health and climate change is not only about vector-borne diseases, which some people think. It's not only about the trauma from hurricanes, because some people die, but it is affecting the whole spectrum of service delivery. Remember I spoke about the building blocks of the health system? It's affected every one of those building blocks. And therefore, as we begin to look at what we do, we have to look at it from a holistic perspective. Secondly, the impacts will worsen over time because of the projections I've shown for climate change. So we're complaining about the heat now. It's going to get hotter. We're complaining about the strength of the hurricanes. We're going to see stronger hurricanes. We may see less, by the way. The jury is still out on the number, but whenever they form, they could be a lot more devastating. And there is this new element of the hurricanes that have begun to emerge called the rapid intensification. I don't know if anybody follows that, where hurricanes move a category or two within the space of a couple of hours, I think 12 or 24 hours, which makes it dangerous because you may have, and that's what happened with Maria in Dominica. You had a hurricane as a category 1 hurricane or category 2 hurricane off the country, 24 hours away from the country. And within that 24 hours, it moved from category 2 to category 4 or category 5. You're now thinking, okay, tomorrow we have something coming that's category 2, we're going to prepare for it. Time it hits you, it's category 5. And that's what makes it so dangerous now, that the hurricanes not only getting stronger, but could also, in fact, intensify very quickly. The third general conclusion is that the climate change impacts will affect vulnerable groups. And therefore, we need to begin to look at how do we protect children and adults, for example, in water-stressed communities. People in low-lying coastal areas who are at threat from sea level rise and flooding. What's going to happen to them? How do we help them? People working outdoors. This is an agricultural country. Can people continue to work in the fields with the heat being the way it is during some of our months of the year when the heat and the humidity is high, which is part of what's happening now this time right now? The impact on respiratory problems, asthma, and so on are also things which we need to look at. So in addition to looking at holistically how it affects the health of the population, there are these vulnerable groups whom we have to pay more attention to, and what kind of strategies can we develop to be able to help these vulnerable groups cope with the impacts of health. So in general, what we've concluded is that a holistic programmatic approach is really required. Holistic in the sense that it covers the full spectrum of health services. Programmatic in the sense that we cannot just look at individual projects, but we need to look at the interactions with other projects and the interactions between the health sector and the non-health sectors in terms of how you approach the question of dealing with climate change and health. So we're hoping that from our discussions today, you can begin to give us some of your thinking on how such a holistic programming could be addressed and what are some of the things that could be done to address the individual specific impacts of climate change. Let me now hand over to Dr. Telesford, who will take you through the specific findings of each of the dimensions, and then we'll open for a general Q&A for clarifications before we then get into the breakout groups. Thank you very much, Dr. Telesford.
Okay, so good morning, everyone. And we're going to continue, but I'll be a bit more specific in terms of what we found from the study, and also some of the impacts that we have realized here in Grenada and some of the results from the statistical analysis. And let me begin by saying that it is important as we speak about climate change and health, it is important for us to understand the impacts that are within our context as a small island state, as Grenada. So what we have been using over the years is the data from the region at large and data from the international community. But it is also important for us to understand what is happening specifically within the Grenada context. And we attempted to do that as part of the HNAP process because we wanted Grenadians to understand what is happening in Grenada and make decisions that are tailored and very specific to our context, okay? So I'm going to share with you some, we call it heavy data. We're not going to get into the statistical issues, and Dr. Ford knows very well that I'm very much afraid of statistics. But when I'm paid to do statistics, I will do it. So I've done it, and I'm going to show you what we came up with, some of the issues and some of the things that we have to look out for here in Grenada, okay? So, right, specific findings. So first I'm going to speak about the climate-sensitive diseases in a general sense, direct effects, and then I'll speak about the indirect effects and then move on to the diffuse effects. So here we see, when we speak about the direct effects, I'm going to move a little bit, and we speak here about the health impacts of weather-related diseases and emergencies. We speak about things like physical injuries and so. Now, you remember after Hurricane Ivan, we had some deaths in Grenada. Is that true? And not just deaths, but we also had persons who experienced physical trauma We also had pollution of our water sources and even the air as well. Some persons spoke about things transported by wind and now present in our environment. Pollution as well. We had things blown around, etc., and the loss of livelihood. Now, when we speak about pollution, this is something that oftentimes we think about the air and water. But we also have pollution of our food resources as well. Because you can have pollutants and very serious pollutants blown or transported in air and deposited on foods that we consume in its raw state. And that's something we have to think about, right? When we speak about things, for example, like Sahara dust, this is not even, we don't consider it maybe as a disaster. But several studies have shown that mercury, okay, and other heavy metals and other pollutants are transported into our Caribbean region, deposited in water, and of course deposited in our soils as well, etc. So when we experience these kind of disasters, hurricanes, etc., we have to think about that as well and the implications on health. Sometimes it is not readily evident because sometimes we do not go immediately after and test the soil, for example, to see what is there. But those things do happen, and it's something that we need to be mindful of. Heat-related illnesses. Again, I believe we might be experiencing a heat wave in Grenada. We are, all right? Okay, dehydration, heat cramps, heat stroke, okay? We have respiratory diseases as well, cardiovascular diseases, and other chronic conditions resulting from exposure to high temperature or extreme temperatures. And this is something that we need to be mindful of. And I wanted to share with you some of the findings from the study that I did here in Grenada. Met Office is here. So when we did last year in August, we concluded the heat study here in Grenada. I was contracted by PAHO to develop the methodology for the Caribbean to do heat health studies. So Grenada was the pilot country. We did it here, and that method now will be used by the other countries in the region. In fact, yesterday, a country all the way in Africa called for the study as well, because they most likely will also use the methodology, and they're supported by USAID to do those studies as well. So what we found the result from that study indicates that when temperatures is high, 31 and above, or maybe 30 and above, more death in Grenada. That's what we found. Temperature affects mortality in Grenada. We looked at data from 2008 to 2020, an extended period, and we found a relationship between high temperature and mortality in Grenada. We looked at mortality, visits to the emergency room, and hospitalization. There was some impact also on the amount of persons being hospitalized. But mortality, there was a significant relationship between high temperature and mortality, and especially when combined with humidity. So what we did, we tested what we call the heat index, which is a combination of temperature and humidity together. And when those two are high in terms of the units, then death or the mortality there is excess mortality in Grenada. Now, when we were first contracted to do the study, I remember saying to Paho that people in Grenada are accustomed to heat, and I don't think we'll find anything. So I was totally shocked when those results were generated. So heat really is a problem for us here in Grenada. We read and we listen to the news, and we see what is happening in Europe, etc. It is also happening here in Grenada, all right, in terms of deaths here. So let me go on a little bit more. So the indirect effects now, waterborne diseases. Again, this is from both ends of the spectrum. When we have during the dry season, we have poor storage because people tend to put water into barrels, etc., and store, and you could have contamination. Sometimes you have diarrhea or AGI, acute gastrointestinal illness outbreaks during that time as well from the poor storage of water, but also when we have heavy rainfall, all right, the water supply can be contaminated as well, leading to those diseases. We can also have leptospirosis, also worm infections, helminth infections, etc., right, as a consequence of the pollution of water resulting from these events. Food security and food safety is also an issue, and those have implications. This has implications for health. Sea level rise. Right here in Grenada, in the north, Dr. Marcel is here, so he can bear me out on that one. In the north of the island, farmers are complaining about seawater intrusion, affecting even crops and so, right, where they use well water. And at certain times of the year, even though it's dry and they have their wells to source water, still they cannot use the water because it is salty and not good for the crops. So we are experiencing those things right here already in Grenada. Storm damage and drought, again, also has significant impact on food supply. Now, we also have to consider the nutritional effect as well, because during the dry season, or when we experience drought, as we did, I think, around 2008, 9, and 10, about that, we had drought in Grenada. Then we noted here that some of the healthier foods, vegetables, etc., it was not possible to have a high or sufficient production of those kind of foods when you have drought conditions. And therefore, it has implications also on the nutritional status of the population. Vector-borne diseases, I think we had some presentation on that already. But note here that we have emerging, and I would say new in the Caribbean context. We did not know anything about Zika and chikungunya a few years ago. All right. We have also seen the increase in dengue cases. Okay. So vector-borne diseases. Again, climatic conditions affect the habitation and reproduction patterns of these organisms. All right. So, and in turn, they implicate the cycle, reproductive cycle, and the habitation where, right, they habitate. Those will affect, again, population health. Okay? So those are things that we have to be mindful of. Now, still on the indirect effects, zoonosis, zoonotic diseases, so things like Zika and so, things that are transmitted from animals to humans. We do have, in many countries, reports of higher increased prevalence of those diseases, as well as a shift in terms of the population that is affected. The African countries have been doing a lot of studies looking at zoonosis. Rabies, for example, is one of them. A shift in where mongoose are habitating, right, to warmer, drier areas. So they are moving as the the zones become drier and hotter, etc. I believe there might have been a study here in Grenada, Dr. Noel, with regard to mongoose population in certain parts of the island. I think there is a publication for Grenada, but I can quickly check. But I think there was a study done here as well. All right? We also see respiratory illness from allergens. So we have, during the dry weather, for example, or certain crops, certain plants flowering at certain times of the year. And with the change in the climatic condition, it might be a longer period that we have pollen and other things in the air. And so that might affect persons with a certain respiratory condition. In other countries, we've seen also and noted a relationship between influenza and weather conditions. And I'm going to show you what we found here in Grenada. Sanitation, post-sanitation arising from hydrometeorological events, and this facilitates also the spread and multiplication of pathogens or organisms that cause diseases as well. So when it's wet, sometimes that facilitates certain conditions, microorganisms, multiplication, and so, all right? And even when it's dry, some survive better in drier conditions. So either side, whether we speak about heavier rainfall for extended periods or drier condition, as the climate changes, so too we expect changes in the pattern of these organisms. Heat trauma from adverse events and the impact on the food systems. I think we already touched on that, spoke of that. Now, let me just go on to the diffuse effects. Mental, psychosocial health. This is something that we often do not consider, the severity of the psychological impacts on persons who experience and are affected by climate change events. And it's something that, as we think about the HNAP, we also have to consider how we are going to respond to persons who will have been or who would have been affected by mentally and psychologically by those events. Now, you recall after Hurricane Ivan and then Emily, that a lot of people remained traumatized for a long time. The rain started falling and some persons were scared, you know, just by heavy rainfall thereafter. Wind blow and you know, if it's too strong for them or they feel that, this is not normal, they feel a bit traumatized again because there is the reliving or recall of the experience from Hurricane Ivan. And we have not as yet spoken about the impact on children, all right? So after Hurricane Thomas, for example, in St. Lucia, I think it was 2010, UNICEF sent me over together with, I think, 4 of us from Grenada. We went over to St. Lucia to work with children there who were affected by the hurricane there. And it was really, you know, a traumatic and a sad experience for children sometimes. The adults, we can cope. We can deal with some of these things. But when children experience these events, like hurricanes and volcanoes, storms, you know, and some of these other events, it can traumatize them for a very, very long time. So that's something we need to be mindful of as well. Okay. So don't worry too much about the biostatistics. Dr. Ford is a good biostatistician. He actually taught me biostatistics. So if you don't understand anything, you'll ask Dr. Ford when the meeting is finished during the break. Ask Dr. Ford. Make sure you're on his table for the lunch break. So he will tell you, because he taught me statistics, so I cannot be better than the teacher, right? Okay, so what we attempted to do in this HNAP process is to clearly understand what is the relationship between certain diseases that are recorded in the Ministry of Health in terms of the prevalence and weather or climatic conditions. And we looked at temperature, rainfall, and relative humidity. Those three factors we looked at. Because we already know that there was a relationship from the study we did before with some of temperature, humidity, right? But we included rainfall as well to see how those things were influencing or whether there was a relationship between those and these certain diseases. Now, when we talk about relationship here, what we're trying to establish is whether the relationship is also significant, meaning that it did not happen by chance, but genuinely there is a relationship. Now, we're not establishing a cause effect, but whether there really is a relationship between those factors. So we looked at dengue fever. So this was one of the Ministry of Health collects data on dengue fever. We also looked at acute respiratory illness, and I'm telling you, as the ministry gave it to us, acute respiratory syndrome, so they collect those differently, so we analyzed it differently. Asthma, diarrhea, AGI, acute gastrointestinal illness, leptospirosis, and then the ministry had asked us to also look at undifferentiated fever. So we looked at those, everything that they asked that we look at, we did. Dengue fever, we found a weak, and this is relative risk ratio. So don't worry about all these terms. But what we found was a weak but significant relationship. Didn't just happen by chance. There really is a significant relationship between temperature and dengue fever, with the likelihood of cases increasing when average monthly temperature in Grenada was higher than 29 degrees Celsius compared to the reference 26 degrees Celsius. So what we're doing here is we take temperature and we look at the unit change and try to determine whether there was a relationship between that particular unit of temperature, right, and disease outcome. So we started at 26. We used 26 as the reference temperature here. And we looked at 27 degrees, 28, 29, yes, and we went right up to the maximum of, I think 32 point something is the maximum we've ever experienced in Grenada. So we went up. And when we got to 29 and above, there was a significant relationship between those temperatures and dengue fever. So as it gets warmer in Grenada, we're likely to also experience more cases of dengue fever in Grenada. Everybody understand that? Right? So this is what we found here. But we also looked at rainfall, as I told you. And I know Mr. Charles insisted that we include rainfall as well. And that's a good thing. Luckily he did that. Because we did find also a significant relationship between rainfall and dengue in Grenada, with the likelihood of cases increasing, with average monthly rainfall at 271 to 300 millimeters compared to less than 90. So it's raining and it's warm, more than likely Grenada will have a lot more cases of dengue. Everybody understand that? Okay.
My question here, right? The first one is just related to temperature.
Yes.
And the second one is related to
Rainfall. Yes.
So you just said it's raining and it's warm. So is there anything when it's raining and it's warm? Because that's a different thing from it's raining or it's warm?
Either or and together.
Okay, that's what
Either or and together. So we tested them separately, not together. We tested temperature by itself. When the temperature is high, you're likely to get more cases. We tested rainfall by itself. When the rainfall, you have 271 to 300, which is about the max, right? A lot of rainfall. Compared to when it's 90, it's drier, you're also more likely to have more cases. But together, rainfall and high temperature, you're likely to, more than likely, have like an outbreak or something like that, dengue cases. Some more results, foodborne illness. That was another one of interest to us. What we found here, and notice now, this one is not a weak, but a moderate relationship. We found a moderate but significant relationship between temperature and foodborne illness, with the likelihood of cases increasing with average monthly temperature at 26 degrees Celsius compared to 29. This one is a bit puzzling. So when it's cooler, 26 degrees Celsius, compared to 29 degrees Celsius, we found more foodborne cases, and that did not happen by chance. There is really a significant relationship between those two variables. So I think the Ministry of Health recognizes from the session last week that they would need to do some further investigation, right? Because there are other social, environmental factors that might be driving this. Seasonality, for example, carnival time could be when it's cooler, December is, you know, whatever, those events. It could also be, that's when we're the festive times of the year as well, right? So it's possible that, so there is need to investigate, right, further this year. But we did find that relationship there. So we have to rule those out as confounding, you know, factors as well. We have to consider that. Right, that's a good point. Yes, so the data we used was from Point Saline's Met Office. We attempted to get some data from the other parts of the island. Carriacou had just started, they were in their first year or something like that of collecting data. That we can't use that, it's too short, right? And then the other offices, they had a paper-based information that we could not extract that. And in some cases, there was another reason why we did not use data from the Ministry of Agriculture that they were collecting from the other stations. So as Mr. Charles said, in the next few years, because our data collection is improving, in the next few years, we need to repeat these studies to see what is really happening. For now, this is like baseline, right? But we would need to, especially Carriacou now having a system to collect those kind of information, and it's feeding back to the Met Office. But we have to wait some time before we can do that kind of analysis. Influenza, we also found a weak but significant relationship between rainfall and influenza cases when the likelihood of cases, with the likelihood of cases increasing with high monthly rainfall. Okay? So this is what we found for Grenada. So the information there is very specific to Grenada. We use data over an extended period, right? So we were able to determine these patterns. As Mr. Charles said, as we go on, we have to repeat these studies to see whether the prevalence changes. We can look at it in the descriptive data, but also whether the statistical significance also changes, whether there are stronger relationships, weaker relationships, or whether there is probably not or still is a relationship between those factors. So this is something that we need to continue. So we have to speak about now disease management. And what we found is that there is the need for surveillance, to enhance our surveillance system in Grenada, the need for data collection. So for example, the International Disease Classification Handbook has codes that are specific to heat-related diseases. And we need to incorporate those in our surveillance system, but not just the surveillance system, we also need to incorporate those into our medical care, our healthcare system. So for example, when someone goes to the hospital, right, we need to start asking questions related to exposure to heat, for example, right? Or other conditions, adverse events, right? Have you been exposed? What kind of house structure do you have, for example? Where do you work, right? Are you an outdoor worker, etc.? That's the only how we can capture the information to establish the relationship between health outcomes and those environmental conditions or climate conditions. So we need to do that, and reporting and dissemination of the information. All right, so capturing information is one thing, but how do we now have an integrated data management system that requires the input of the metadata, the hospital data into the same system, and probably other data as well, so that it becomes easy for us to do the analysis and better understand climate change impacts on health in Grenada. So we have to consider that. Early warning system. So coming out of the study that was done, the Heat Health study, I think the next phase is for PAHO to now support countries. Well, Grenada, of course, would have already done the study to develop early warning systems. So that would be the next phase. And as I said yesterday, somebody requested the data from one of the African countries that we had, the methodology, so that they can also probably use that method there to do the same study. We had NOAA, the National Oceanic and Atmospheric Administration, right. They also looked at the, too much acronyms. So they looked at the data as well that we did, and we were, commended on that piece of work that we did. So they themselves probably would also look at how they can incorporate that. But we now have a way of determining the impacts on health, but we cannot stop there. We need to know, respond, right? We need to put early warning systems in place. So for example, you can have a multi-tiered system where once the temperature crosses 26, it reaches 29, for example, we can ask people to drink more water. It reaches 30, we can now say something different, stay inside. And when it hits 31, 32, outdoor workers may need to remain at home. But then that has no implications for the economy, right? And for workers. So this is why it's so important for us to do this process, the HNAP, but to do it together. Because everyone, even the laypersons, need to understand how this, what we're doing here, is also going to impact on their health and well-being. Yes, you're welcome. Service delivery, availability of appropriate health services to the population, and I must commend PAHO, and I think CAFA may have a hand in that as well. They have already developed a nice, what they call, pocketbook for physicians, clinicians, as protocols. It contains protocols for treating or responding to heat-related conditions, right? So that's already available. So they can use that, but we need to, in Grenada, for example, every physician should have that. because those illnesses are not just in the other countries. Right here in Grenada, we are experiencing climate-related impacts. So we need to ensure that our healthcare team is well informed and they are utilizing the protocols that are in place to deal with, to manage those diseases. Response and treatment protocols. Oh, sorry, well, I gave it away, so that's what I just spoke about. Laboratory facilities. We just spoke about microorganisms and other pathogens that can affect people in different ways. But we need the laboratory facilities to be on par as well. They should have the ability and the capacity to also test and confirm what is happening. So we used generally a system where we capture suspected cases without laboratory confirmation, right? But we have to move away from that over time, because we have to understand it is not just what is endemic to our country, but we have what? New and emerging, right? Diseases also affecting our population. For example, Zika and chikungunya, right? We were not familiar with those, but we had to strengthen our laboratory facilities to test for and to provide correct diagnosis and therefore correct treatment for persons who are affected. So those are some of the things we found sort of gaps in our system, and those need to be addressed. No public health research agenda. Largely, WENDRIF, Dr. Noel and Mr. Reddy is there. WENDRIF and SGU has been driving the research activity here in Grenada. We have our Dean of Research here, Dr. Ford is our Dean of Research at SGU. But there is a need probably for collaboration so that we can develop a research agenda. So for example, the results that I just showed you, we cannot stop at that. We have to think about research now to understand what is happening with other diseases. Notice here that we did not include non-communicable diseases, diabetes, obesity, hypertension, right? Even cancer. Somebody still has to do the research to understand the relationship between climate and climate change and these other diseases. We did not have it in a format that would have allowed us to do the study at the time. So we need to now disaggregate our data a bit more so that we can understand or do those kind of analysis. So our whole data collection system needs to be revamped a bit, and then we need to now look at how we can capture the data from this enhanced system to do the necessary research and inform interventions as well as policies to protect our population. And as you know, our infrastructure here in Grenada is not really resilient in most cases to climate adverse events. We have had some improvements. I know PAHO and other entities have been working to improve the infrastructure. We had the smarting of some of our hospitals here in Grenada and other institutions. However, there is still the need to upgrade some of the other facilities that we have. If we do get a Category 5, Category 4 maybe hurricane, we may still have some of our facilities being affected. Even maybe a storm with heavy rainfall could be Category 1, 2, but if you have a lot of rainfall, some of our facilities may still be affected, right? And when that happens, then healthcare delivery now is impacted because we have to shut down or reduce the capacity in terms of delivery to the public. Institutional arrangement, we're almost there. We have no formal placement for climate change in the governance framework. So there is a health, that's specific to the Ministry of Health here. There is the Health Disaster Committee, but climate change is not a key focus for that particular committee. So there is still the governance structure is still not in place through the Ministry of Health to implement and to drive the activities that will be incorporated in the HNAP. So this is one of the gaps that we found. The legal and regulatory framework may also need to be updated. We're still operating on some old, quote-unquote, laws that needs to be updated. They do not cater for these modern diseases, so to speak, right? So we need to look at that as well, including our public health law. Human capacities, we have, I'm going to say over and under, but you have a chance to speak in your group, so you will talk about that one. We had some debate about this last week. So over and under supply of professionals in some specialized areas. Largely, when we talk about climate change, we have been providing through PAHO and other entities training to enhance our expertise and knowledge in the area. But still, there is a need for professionals, persons who are highly skilled and trained to craft and to develop interventions, policies, even to drive research, because you have to be understand how these things play out so that you can understand how to design, for example, your research, right? So there is a need for professionals and expertise in those areas still, and also to provide service within the healthcare system. Persons who know what to look for and understand how to get the information and use the information to understand the impact on population health. Financing, out-of-pocket payments account for 47% of expenditure in Grenada, and many persons cannot afford the cost of quality healthcare. And this is something we have to be mindful of. While we understand that climate change will have significant impact on health, at the same time, a lot of people will not be able to pay for the quality of care to alleviate or to manage the diseases that they may experience as a consequence of exposure to these hazards. So that's something that we need to be mindful of, and that will contribute naturally to an increase in the prevalence of diseases. Remember, we're not just speaking about infectious diseases here. We're also speaking about respiratory diseases. We're talking about cardiovascular outcomes as well, right? So we have to be mindful that we may see a peak in those things, not just as a consequence of what is happening in the environment, but also because persons cannot afford the cost, right, of care to address those problems. Stakeholder engagement, there is no formal institutional arrangement for collaboration and coordination with stakeholders and with the other health influencing sectors. So there is not a committee before the HNAP committee that incorporates multi-stakeholder representation, and therefore them being able to bring their perspectives to discuss what is happening across these health influencing sectors. That is still lacking here. So those are some of the gaps that we found in our research and the findings from the statistical work that we did. Thank you.
Okay, so thank you very much, Dr. Telesford. And that's basically what we have found. What we want you to do now is to take it apart in your breakout groups, not in the plenary session, because you'll get a better chance to discuss it in the breakout groups. However, we want to just open for any general clarification anybody may want. In the breakout group, you'll get the opportunity to look at accuracy, gaps, recommendations, and so on. But any clarifications that you may want, please, let's just spend probably 5 or 10 minutes just ensuring everybody's on the same page in that respect. I see a hand here.
Thank you. I'm Deborah Baffigames, representing the Girl Guides Association. And my question is, we're talking about climate change and the impact. Have you looked at this sargassum weed at all and the impact it has on Grenada?
A very interesting question. The short answer is no, it has not yet come up in terms of one of the issues we need to look at. But as you've mentioned it, it's something that probably you could discuss and make a recommendation that that's one of the gaps that could be addressed. Thanks.
I have a comment. I am so happy to see that Grenada has joined the rest of the world in addressing climate change. However, I see a big contradiction. That being, one, mangrove is being destroyed, all over the island. Secondly, when housing project is being erected, all the trees are being removed to put the houses. And thirdly, I have seen that specifically hotels are being built beyond the high water mark. That's my comment. And I don't know if those things are being addressed.
Okay, I think these are valid comments. I think they'll be addressed in the context of the broader HNAP, which takes a look at the overall national economy and all the sectors in the national economy. So as part of the HNAP discussion process, these are issues you probably could bring to their attention once to get there. Okay, Dr. Nixon?
So I'm sorry, guys, you're going to hear me a lot. I'm really very sorry, but you didn't mention Dr. Lindoni. We talked about increased mortality, increased hospitalization, and visits. What affects us? Because I think it's good to understand, and because I'm curious as a physician. One, I'm a little disappointed in the second part of it because you guys failed to me. Okay, this is Sonia speaking. Okay, you guys failed to address the issue of poverty. And you guys failed to look at among your vulnerable populations. Poverty is very prevalent among our population, and we failed to recognize the presence, and I hope Hillary is not here, we have not looked at the disabled. Very vulnerable population when you're dealing with health issues, those, right? So I'm just saying. And I want us to remember the other things in relation to water. When you spoke about zoonosis, I want you to also consider contamination of water by other toxins. You know, dirty water mixing with clean water. We still use a lot of superficial water for consumption, and even for farming, because you can have one farmer throwing his effluent into the river, and the farmer down the road, this effluent from his animals into the river, and the farmer down the road needs that water in the river to wet the pepper and wet the callaloo and whatever he's cooking, he's planting. So I think all of those things have to consider the whole stuff. And of course, please consider disease registries when we're going to talk about looking at how people get sick. That's a very important thing that we can implement, right, without costing a lot of money, so they can do our research in the future. There are a lot of things I want to say while we get ahead.
Okay, thanks very much, and you'll get the opportunity, once you get into the breakout groups, to go into more detail on some of these issues. Clarifications, please.
Just one quick point I wanted to make. I think Dr. Telesford, she would have highlighted, and I'm happy to hear that mental health and psychological health and the impact of those things, but I didn't really hear any statistics as it relates to those things. I'm wondering if there are any, for example, during the COVID period, we know that there might have been an increase in abuse in homes. There was a spike in suicide at a point. So I'm just raising those.
Okay, a question for you, Dr. Telesford. Any data?
I don't know, I think, Terry, can you answer that? The Ministry of Health, because they do not collect data on mental health In the database that I got, mental health was not included. I'm not saying they do not collect it, but in terms of the notifiable diseases, that was the database that we got, and it did not include mental health.
Mental health in crises like this comes under like in health crises, come under the Ministry of Social Development.
Okay.
So that's probably why we don't have information on it.
With regard to the sargassum weed that somebody spoke about, we had a professor, may his soul rest in peace, Hugh Seeley, Dr. Ford, you recall, himself and nurse Idis Mark George, they did a study together. I don't think it was published, but they did a study looking at the health effects or health impacts of the population in the Subis and I think Marquis area, resulting, Dr. Noel, you probably would recall that? Yeah. Subis and Marquis, right? From the sargassum weed deposition on the beaches there. I recall that, but I don't know specifically what they found. I don't know if Dr. Noel, any of you know the finding? Okay, yeah.
Okay, thanks. Yes. Yes, good morning, everybody. My name is Dennis Slocum. I represent the Grenada Chambers of Commerce and the Grenada Cooperative League. My question is, well, first let me commend the study that was done on the impact with the heat and the impact on health and the correlation with death. We understand causation and correlation are not the same thing. But what I would like to know is, within your study, did you consider, based on your findings of the impact between heat and death, did you consider issues relating to the vulnerable population, whether the death, the percentage of death was attributed to the vulnerable population? Did you consider issues such as whether it is a rural area, coastal area, whether it is a particular age range or is prevalent in the elderly? Were those issues, were those determining factors between, because we can say, well, heat has a relation on death, but how, in what way is that prevalent? And while I have the mic, I just want to make a suggestion and a question. Are we considering the impact on climate change as regards to how we approach education? Are we still using the same methods of education? For instance, if we determine that there will be an increase in the temperature in years to come, are we still teaching the same building construction methods that we taught 10, 20 years ago, knowing that in 30 years we'll have an issue with heat? Are we still teaching the same health strategies and procedures in terms of not just at university level, but at primary, secondary, tertiary level, to prepare, because we're dealing with climate change adaptation, to prepare the future. So we're not going to build the same house that will be impacted by climate change 30 years from now, knowing and having that preemptive understanding that in 30 years we'll have a different climate, a different structure than what we have now. So that's just two of the things I want to clarify.
Okay, so I'll take the first one and I'll leave the second one for Mr. Charles. So with regard to the heat health study, we did not do a disaggregation by age group, gender, or parish. And I'll tell you why. We included here the point about the need for data. Now, think about it this way. As the consultant for the project, and the lone consultant, because I did not have a co-consultant, I was the only person contracted to do this work. But imagine having to go into the hospital, and between the nurses and doctors working, going to the casualty, and find the books from since 2008, right? And get all this information out to get this. All paper-based, right? Imagine that. This was how I got the data. And then go sit in a little room in the night or in the day, whatever time, whatever hour, and now extract this data manually to input it into the system for the modeling. It was like the worst thing I've ever done. For all the research that I've done, I think this one was the test. And Miss Anthony is here, but Paho really did stress me out at that time to get this done. But we got it done. But what I'm saying is we do not have a system how we collect data currently. We're not in a position to do this. And that's why this process is so important, that and together we identify these kind of issues, because we will never know the impact on the specific parishes, ages, and other groups, except we have the data. And right now, it's a long, difficult task to get that information.
Okay, I think that was a very good question. The second half of the question, what's happening with education, is an interesting one also. Last week, when we were working with the health sector, they actually identified the fact that the nurses training program needs to be modified to accommodate climate change. That actually came up, that it needed to become aware of what the issues are and how they can respond to it. So the health sector has begun to be sensitized to it. In terms of the wider community, I think that's something which the HNAP will have to pick up in terms of education at a wider community level. Because yes, we're talking about things that can impact on health, but in terms of taking the lead and getting it implemented, it will be done better through the relevant sectoral ministries. So just like health could do the nursing education program, there would have to be some other one which could lead on construction, because you're correct. Your construction thresholds will have to change. We see what's happening in the developed countries, roads buckling, train lines warping, and all that kind of stuff. The temperature crosses a certain threshold, and it's going to start happening here also. So we need to make our adaptation points going forward. So that's an important cross-sectoral point, which we could probably bring back into our discussions with the HNAP. And I said we have the HNAP coordinator here, so at least she could also begin to take notes that we need to have that discussion at the level of the HNAP. Okay, yeah, last point.
Just one
and
more
then
question.
we'll take a break and come back. Yeah.
Good morning. I'm Jerron Griffith, representing the Bank and General Workers Union. My question really is to deal with...
Put your mic closer to your mouth.
My question mainly is to deal with labor, because I was listening to the findings and so forth, and I realized that it wasn't really in depth on labor, specifically with employment safety and gender-based challenges as we adapt with climate. We have, in Grenada, we have a lot of workers who work outside or exposed to the elements. So what are the challenges these workers face? Not only workers, but also I could go further to go on to students and so forth. What are some of the challenges and the health risk with that sector, and how are we looking to combat them in the future? So that's just my insight based on what I was transferring.
Okay, very good question. We flagged it as one of the things, but we did not do a detailed analysis of it. We're hoping, and I'm putting the ball back in your court, we're hoping that from the discussions today, whatever small group you're working with, you can flag that as one of the issues that needs to be put onto the HNAP going forward, that we need to do a much more in-depth analysis. Because we have no research done on that yet, so we really cannot pronounce. We're trying to be as concrete as possible, identify what we have, and what we don't have, we identify it as a gap which needs to be closed. So that's one gap that you need to flag as we go forward. Okay, one final question before we take a break. I see two hands. I'll compromise and do both of you. Ladies first, if you don't mind.
Good morning. I'm Joanne Peters, representing the Chamber of Commerce. And it's a very short question I have in regards to the storage bank unit. I haven't heard anything mentioned on that, but a lot has been said so far, a lot of reports, findings, and so forth. So is there any work in progress as to considerations as to starting, or if there's any ongoing with storing all this information and other research that was done? Because to have it available so users and everybody can access it quickly, and then you can make decisions from the data that's just been inputted into it?
Okay, good question. You're talking about the whole knowledge management process. That was not part of our remit, but it could be a very useful suggestion coming from this consultation that some knowledge management process should be established so that people can access the information closely. So I look forward to seeing a recommendation for whichever breakout group you're working in on knowledge management. Okay, thanks.
Was there any influence from a transportation modality affecting health? Or should we be moving back to open buses and things like that?
No, we haven't yet gotten to the point of transport. But I must say, this is where we have this group here. You know, you guys are raising the things that which we want to know. What are the other things we need to look at as we begin to work on climate change and health? All of it would not be able to be addressed in the HNAP. Some of it will be areas for future work. Some of it will be areas for further research. But we need to build that agenda so that we can develop a comprehensive approach. So transport, we didn't look at transport in any specific sense. But again, it's one to flag along with knowledge management, along with SAGASM, and all the others as areas. So one of the questions you'll see when we come back to the breakout groups is what are the gaps? What are the things we haven't addressed yet that you want us to address so we can take a note of it? So very good point. Thank you very much. Okay, so let's take a break here because we can continue that discussion. What we want to do from here, first of all, we have a small refreshment break. And then from that, we'll come back and we'll then reassign ourselves into breakout groups with organized facilitators who will walk you through some of the issues that we want done. So I'll do a quick overview of what the breakout groups will do, and then we'll take it from there. You should have been given a number when you came in. I hope you haven't lost it. That number is the breakout group you're going to be in, number 1, 2, 3, and 4. It's also a door prize. Well, we could have a raffle, you know, and come up with a nice prize which you could think about over the lunch break. So let's take a 15-minute break because we are a little behind the schedule. I think the information was useful, so I allowed it to run. We'll come back at 10 to 12, and we'll get into the breakout groups right after. Thank you very much. is to move into smaller groups where you can focus on the issues which you'd want to bring to all. We have hello. Behind the camera, where Dr. Walters is now seated, and group number 4 will have the sea view. You'll walk outside, and group number 4 has the sea view. You'll walk outside, and you'll have all the, and you'll be close to the food. Okay, your facilitators. Let me just introduce your facilitators. Group number 1 will be facilitated by Diane Roberts. Just stand so they'll see you. Okay, and you'll walk up here. Group number 2 will be facilitated by Dr. Noel, who will walk with you in the middle. Group number 3 by Ms. Ragobir. You will be, you want number 4? Okay. Number 3 will Ragobir, that's in the back, and number 4 will be done by Kenita. You have the sea view and all the nice goodies. Right? Now, the presentation on the screen. We want each group to consider 5 questions. Okay? Some of them are really straightforward, but it's just for comprehensiveness. The first question is, are there gaps in the analysis of the current and projected impacts of climate change on health? Okay, so if there are any gaps you think we've missed, a couple of points came up already this morning. Please feel free to tell us so we can get this comprehensive picture that we're looking for. No, yeah, well, the facilitators will ask the question. Yeah, but the facilitators are briefed, so they will yes or no. Question 2, are there gaps in the analysis of Grenada's health system's capacity to address the impacts of climate change? So again, anything you think we've missed, flag it for us. Question 3, a very important question because you are the people who are not working in health. So question 3 is asking, are you aware of any climate change adaptation or mitigation policies in other sectors that pose a risk for health? So is there anything happening in the sector you're working in? That's a question you have to ask yourself, and each of you could do it, that pose a health risk which the health sector needs to be aware of. I'll be quite frank, when we met with the health personnel, they indicated that their relationship and their linkages with the non-health sectors are not very strong, so they may not have much of that information. Notice we didn't present much today. So if you know of any in your sectors, please flag them so we can have a sense as to what else we need to do in incorporating the non-health sectors. So these 3 deals with the comprehensiveness, as you see how we say a gap analysis. Then number 4 is where we really want you to come in with strong recommendations. What measures would you recommend for strengthening the health sector's ability to address the impact of climate change? And we'd like to get from you, what do you think should be done? And in this case, your facilitators have been instructed to ensure that we do not come up with a wish list. We want actionable, implementable recommendations that's going to make a difference. So your facilitators will ask you questions. If you say, let's do X, they're going to ask you why and what's the benefit. So it's not that we want to put anybody on the spot, but it's just that we want to come up with, hopefully, suggestions, recommendations that's going to make a difference in making the health sector resilient to climate change, which is our overall objective. And then the last question, if you have the time, what priorities would you recommend for the concept note for financing? What do you think we should spend our first access to funds on so that we can get the ball rolling? And again, we'll ask you why is that a priority? So the operational question all the time will be, why are we doing this? So your 4 facilitators have been briefed. I am not sure on the balance in the groups, because we designed the numbering system for 50 persons who conformed. We have 40 conformed, and 5 people chose to stay home and view it online. So we have 40 people in the room. So what I'll do is, after the groups have formed, I'll come around, and if there are 1 or 2 groups that's not properly balanced, I may ask a couple of you to move around. I hope you wouldn't mind if we do that, right? So you'll have to rearrange your chairs and tables a little bit to get your spaces. We will reconvene in plenary at 2 o'clock. I want to suggest you walk in the groups up to 1:30, and then we'll take lunch 1:30 to 2. You've had a late break, so you shouldn't get hungry very quickly. You might get sleepy afterward. So you have 2 hours to work, basically. Thank you. No, stay in here. You will come back down here. Okay, so let us reconvene, and in terms of seating arrangements, you're free to use whatever you want. You could stay as a group if you want to. The important point is you could be in a position where you can hear what's happening and can also contribute to the discussion which we're going to have. I must say I was very impressed with the work I saw in the groups. I passed around a number of times to hear what was happening, and people were very intent, and I heard quite a lot of suggestions that seems to imply quite a lot of work for me among other people going forward. But that's all good, because what we're looking at is not presenting something to be done tomorrow, but developing a plan which will go over an extended period. So hopefully the ideas you put forward will give us the basis for that kind of planning. What we want to do is to get your reports, but I want to do the reports in a slightly different way than you normally might have been accustomed to. Rather than having each group present everything, we'll take it one question at a time. So we'll take question one, we'll hear all the groups, then question two. That way, we will remember the linkages better than if we heard everything from group one. The time we get to group four, we have no idea what group one said. So we'll see where there are linkages, where there are differences, and also give you the opportunity to query the differences, ask another group why they did that and didn't do that, and so on. And that's the kind of interaction we want to encourage. That if a group has something that you're not clear on, then you ask a question, so we have a nice discussion on group one, on question one, then go on to question two, then go on to question three, and so on. Okay, so that's how we're going to be doing it. We're going to be very random as to which group starts first. Again, very flexible on that. So for each section, I'll ask which group wants to start, and then the other groups will chip in after that. Okay, any questions on process? Hopefully we should be able to get through in about an hour by 3:15, 3:30, so you wouldn't leave here after 4, but you leave within the time frame which we had promised from the start of the day. Okay, so our first question. Are there any gaps in the analysis of the current and projected impacts of climate change on Grenada's health sector? And to quote Dr. Nixon, if yes, what are these gaps? She said we have to pay her for that bit of advice. Okay, so which group wants to start? Question one. Who wants to go first? Group one. Who's group one? Up at top here? Okay, so group one.
And I hope all the people who are not in group one said group one.
All right, go ahead.
Good afternoon, everyone. So we're just reporting on the first question. All right. First, we acknowledge that some of the gaps may be related to limitations in the available data. We heard that? You heard that? So the first acknowledgement is that, yes, we'll all acknowledge some gaps, but we do recognize quite a bit of it is attributed to the lack of data, and that would have been discussed when the information was presented. So we still wanted to highlight some things. So most specific factors relating to age, geographic location, occupation, non-communicable underlying conditions. So generally, the need for disaggregating the data based on whatever demographic and other data exists. Relating to mental health, we would have liked to see, or still like to see, what's the relationship between various climate variables and psychological effects. The impact on health and safety practices. So, for instance, how does the increase in temperature affect the appropriate use of apparatus to protect protective gear? How does that affect how people actually use those gears and the availability of such? One thing that we would Also like to see that we thought missing, the health impacts on the quality of learning. So yes, we understood that this kind of crosses into education, but in terms of the health impacts, how does that affect the quality of learning, the physical, mental, emotional health impacts specifically? And we are curious about the seasonal variations in the data, if that was considered, and how that impacted the results that were obtained. Okay, 2 more points. So we were interested in figuring out the effect of health risk or the impact of climate change on various sectors. Construction, tourism, agriculture was one sector more greatly affected than the other, vice versa. Anything that was recognized that led to the increase in the death rate, was that specific to any particular sector? And generally, what was the economic cost? And lastly, impact on air quality. So this we're suggesting as an additional climate variable to be considered should the study be expanded. And the impact of communicable diseases on the results found. So again, going back to my disclaimer, we do acknowledge that there are gaps resulting from the general lack of or limitations in the data, but these are some things that we thought would be important to consider going forward.
Okay, thank you very much. I wouldn't comment yet. And let's say the other groups. Group number 2. Who's speaking on behalf of group number 2? Okay. On the same first question.
So good afternoon all. Trust you can hear me. Clearly, our input on the question, any gaps in the analysis in the current and projected impacts on climate change on Grenada's health sector. Yes, we did discover some gaps. I'll just go into detail some of these gaps we encountered. First, our gaps really mainly deals with the data collection, and it's quite a cross-section of different entities and so forth that's been affected. So by that collection, we highlight on the education, like consultation, whether we got information from different groups and ages from the education sector and how climate change is going to impact on their health, especially in learning and the ability to focus on, the different mitigation plans we might need to implement into encouraging students and other persons to combat the challenges that arise with climate change. We also looked at gender equality, mainly how it affects persons based on the gender and the gender roles they play at the different institutions. What type of feedback you got from those persons and how we mitigating going forward with them. Also, we looked at inclusivity, meaning that persons with challenges like, I don't want to say disabled, but differently able. That's the term now. Differently able persons among us. We look at the analysis and we saw a gap there in the challenges these persons may face now and how they relate to the whole issue of climate change and especially on their health and them accessing facilities and so forth and being able to be comfortable doing so as any other able-bodied person. We look at the labor force in a comprehensive way, mainly dealing with the workplace health and safety and the challenges that would arise and receiving data from these institutions in terms of workplace health and safety and the challenges with climate change, meaning that we might have some environmental challenges such as workers don't have to deal with hotter workplaces or environment, right? You have to deal with, like, especially agricultural workers. They work in the field and they're exposed to the elements. And you know the elements can be harsh, especially that heat wave we experience. And you know, if you're in the field, it would be quite a challenge. So you have to look at aspects such as the work hours and other things that could cause these persons to be sick because of the climate. And the mental stress and the stress and mental implications you may have on these persons. Also, we have to look at human resource. It could be a challenge for human resource because certain jobs may require you to be out in the field and it might not be appealing to everybody to be out in the field. So we have to think about that in terms of that question. We think of the aspect of youth, and we have a nice little slogan called "Be the change you want to be, or want to see." Sorry. So we think about youth. We think about them coming on board to give feedback. They should be in the process. And we didn't really see that there in the whole planning, the youth giving their contribution and saying what challenges they're experiencing. So we'd like to see, hopefully the youth get a chance to chime in this whole conversation. And also, one of the gaps we discovered is we didn't see a broad community involvement. We didn't get that tone from the presentation, and we think that the community is extremely crucial in dealing with climate change and how we go forward. Community involvement is crucial because these are the persons that will be impacted by dengue fever. These are the persons who will be impacted by rodents and other vectors that transmit diseases. These are the persons that will be impacted by the hot sun in the house, and you need a fan and certain, et cetera, et cetera. So you have this climate change have a huge impact and implication on them. So we just wanted, hopefully in the next presentation of a document, we have these inputs in there. So that's it for my group.
Okay, thanks very much. Group number 2. Group number 3.
Good afternoon, everyone. Okay, so we have, this group 3, we have identified gaps. We looked at the human resource aspect of it, the human resource component within the healthcare sector. And what we realized is that there are a lot of different parts missing, especially in specialized areas. And when there are different health emergencies, then we realized that it cripples the healthcare sector. So for instance, when we had CHICV or even the pandemic or so. So what we noted is that we need to have an inventory where we assess who we have, the sort of capabilities. We look at retired persons who are about to retire, so that we have just a stock of who we have, what we may need in the event that there's an emergency. Also, we've stated that there should be succession planning. So we know persons are retiring, how are we going to phase them out? Do we have new persons coming in that can replace them? Also, the development of an auxiliary or database, and also there should be support, it should include support services. So for instance, we spoke about organizations like Red Cross and St. John's Ambulance and so, how can we beef them up so that they can lend support to our healthcare workers during an emergency or disaster? We also looked at brain drain and the way that it can impact our healthcare sector. And we looked at Hurricane Ivan in 2004, where a lot of persons, trained personnel, they left Grenada to go to other countries. So how can we limit that, or if it happens, how can we bounce back? So how are we building resilience within our workforce? Another thing that we spoke about is the organization of data management and analysis. We spoke about the support services in data management and also institutional arrangements to access data. So what we realized is that there is sort of like a gap between different institutions with data. So how do we bridge that gap? I think I said everything that I read. I said everything that I needed to say. Sorry. Another thing that we spoke about was like in terms of recruitment, how do we recruit, how do we maintain, how do we keep persons there within our workforce, how do we go about designing that data management system, and lastly, training for persons within the workforce. How do we go about that as well? Okay, thank you.
Okay, group number 4.
Okay, good afternoon, everyone. Some of the points that we have, some of them were already mentioned. So with regard to question number 1, labor, and specifically occupational health and safety, and one of the brothers spoke about that. Today we have been mentioning about, the increase in temperatures and people working out in the fields, but we also have to remember that at a number of job places here in Grenada, people work indoors and there is no AC, there is no air condition there. So with the increase in temperatures, that's something that we'll have to look at seriously. Also, what will be the implications, for insurance companies and so on like that. Another gap we've identified, the impacts of climate change on health of people who are differently abled. Another one, access to health care. We not only have to look at getting to the medical facilities, but also the time frame for getting services and the conditions at the medical facilities for people waiting to access health care or to receive medical attention. We know the conditions of some of our medical centers. There's a particular medical center here in St. George where people end up waiting in the road on the sidewalk. So if we're having temperatures going up, and let's suppose you come down with a heat stroke and you have to go there for medical attention and you have to end up waiting out on the sidewalk in the hot sun. So these are things we have to look at as well. And in terms of the composition of the committee, we felt that the Ministry of Education should be deeply involved as well. Also civil society organizations, as was mentioned earlier on. Thanks very much.
Okay, thanks very much. So we've heard the 4 groups. Does anybody want to react to anything from one of the other groups? Ask for a question of clarification or raise any points related to what they have said? We had one group talking about much more detailed research. I heard group 1 coming up with more of a research agenda. We had group 2 and group 3 focusing more on the human resources and the practical side of things. And then group 4 coming up with a number of different options, including the composition of the HNAP committee and so going forward. So in a sense, it was good that we have a broad spectrum coming from all the groups. But any question anybody wants to raise on any of the groups? Okay.
So, we talk about access to care and we think about getting to the health center, but there's another component of access, that is getting treatment. So, let's imagine you lived in, my family lives in Lamode, and to go to the shelter, if you don't go to the shelter before the hurricane or before the flood, you're going to wash away, because everywhere to get out to where the shelter is, have bridge. Okay? So by the time we get there, probably flood over. Okay? But the point I'm making, if I'm in a place where my access to care is broken, and I have asthma, it's okay if I get there. What if I get there and they don't have any medications? Because sometimes you've got that component of access. Access to care include not only getting there and getting a prescription, but having the medication in your hands. So it also means you have to think about enhancement of the people who provide. And there's another thing somebody brought up, I think it was the third people, talking about building capacity of health personnel to manage emergencies. I still live in Boston in the year when they had H1N1, and the Boston had a medical reserve corps, and I see how we're trying to do it, because that's one of the things I thought needed to happen in the recent days of the pandemic, because I still think that we have a lot of COVID around. Having people who you can call upon, right? So I want to ask you guys, if we had a storm tomorrow that destroyed almost everything in Grenada, which is quite likely for a category 5+, okay? Who do we call? After what we learned with the pandemic, do we have people, a core of people, a reserve of people who can come? Are we going to tell a nurse in the back there, "Oi, leave your children and come," because she ain't coming, don't leave her here? Seriously, do we have that core of people? Because that's one of the things you guys just mentioned, I think it's the last group, that we don't think about, having a prepared core of people who, even if you don't have a crisis, are capable of managing a crisis should it appear. So thank you for bringing that up.
Okay, thanks very much. The question on the medicines is an important question. And if you recall this morning when I did the building blocks of the health system, one of it was access to essential medicines, because you have to be able to treat, otherwise you're really unethically bringing people and raising their hope and not being able to deliver a service that should be delivered. So it's a very valid point, and I think it's one which we have done as part of the structures which we're working with. On the question of who do you call, we have the Deputy Director of NADMA here, so I want to put her on the spot to answer the question.
All right, good afternoon all. So for Grenada, there is a listing of various things. So for example, EOC management, health services, but we can also call on our regional focal point, which is ODPEN, Trinidad and Tobago, according to the CDMA structure. And through CDMA as well, we can also make arrangements for others from within the region to come into support. But the importance of capacity building locally is noted. And we, through CDMA, we are getting some help with that.
Okay, Hayden.
No, I just wanted to add to the point about having the medication, but you also need someone who can responsibly assist with telling you how to use it. Because I have had some unfortunate incidents in that regard myself, but the example of the asthma is critical because you have people prescribed asthma inhalers and medication, and many other and they can't, the folks that are giving it to them can't tell them how to efficiently use it. So as I said, we could keep going, but that's just to add on, and hopefully each point we make leads to the next.
Okay, thanks very much. Yes?
On the issue of medicine, just yesterday afternoon, through the auspices of Columbia University, I was on this webinar in which medical students from Virginia and also Texas was discussing the issue of heat and other related issues. And one of the things that came up was the effect of certain medicine on people in relation to the heat, and how do we take account of people's sensitivity to certain medicine? We need to start thinking about that here. Thanks.
I think dehydration is one of these issues. High blood pressure, where the hypertensive medication drains you of the liquid, and therefore, right, and therefore a hypertensive person is more susceptible in a hot environment than in a normal environment. Okay, so yes, Diane.
All right, thank you so much, Mr. Charles. I think the point that Group 4 made, I thought that was an interesting one regarding the habitability of our homes. I think we mentioned that in the former discussion, that really and truly the issue is what's the impact of that going to be like in terms of our ability to adapt Because just a real example that I have a very open plan home. And the last couple of weeks, I've never had my living room feel hot. And I mean, my home is one that's, as I said, a lot more ventilation coming. And I think that would really, what I was thinking about, I mean, I know we read it in the books, but I was thinking about what is that like for the elderly, the person that is supposed to be home sort of like 24/7, right? And you lock up and you don't have very much vegetation around, and you can't really go out. And the fact that we heard this morning that we're going to be having increased hot days and hot nights, that is definitely going to be a key concern. So I supported what Group 4 said on that. Thank you. More studies.
Okay, thanks very much. So I think from question 1, what we've gotten so far is a call for a stronger research agenda, a call for a wider spectrum of analysis, a call for human capacity development. Those 3 things have come through very clearly, plus enhancing service delivery generally, including access to medicines and so on. So thank you very much. I think we've had very good constructive discussions on question 1. Okay, let's move on to question 2. We'll take the same sequence. We'll take the groups from group number 1 come through. So group number 1. And question 2, can you, is there any gaps in the health service? What's the question?
Yeah, so gaps in the health service capacity to address.
Okay, in the health service capacity to address climate change. Okay, thanks. Okay, so, yeah, flip.
You hear me? Yes. All right, so we identified really 5 things. We do appreciate in the presentation that it was very clear. It was outlined different pillars and building blocks, but we felt, and I very strongly felt too, so I'm glad I'm presenting as well, that we didn't really get what is the actual state of affairs in terms of our health capacities, using the various pillars as a guide. So one of the things that specifically, so yes, that's the first point, that we, from the presentation, I think more could be done in terms of improving it and strengthening it, that for each of the pillars, really the state of each one of them is made more clear. And then in terms of health financing, sectorally, the resources within the health sector, and then individually, how individual persons can finance and access their resources, the health resources that are available. Those are points that are important to include. And we just were talking about the availability of essential medication, particularly during a disaster, and the comment was made even outside of a disaster, sometimes we do have limitations within the health sector, whether it is these are due to general financing, shipping practices, infrastructure, procurement policies, individuals' access and equity to access the essential medications that they have. Those are some things that we need to consider when we look at the current state of the health system in its ability to address the impacts. The 4th thing, we discussed already in our general conversation the general lack of climate change agenda in governance and the importance that it be included going forward. And this is, I guess, a call for beyond this group, the health ministries and so on. And finally, the general lack of resources and the impacts of that. So whether it is a lack of specialized skills in terms of human resources, or lab facilities, general availability of funding, again, at a sectoral level or individually, and our lack of equipment that is required to help us address, whether it is monitor, survey, record, some of the impacts of climate change. So these are the general gaps in the analysis we identified.
Okay, thanks very much. Group number 2.
You hear me again? Great. So we did identify numerous gaps. We started with maintenance and the creation of a registry, especially electronic registry, that would collect data on, specifically on illness, especially those that related to climate change and so forth. So you have this record being created, and it could be at the fingertips of the persons who need it in order to, what we would say, to have a more comprehensive analysis when dealing with these changes and so forth. So we think it was crucial that such a registry to be created, and not only just created, but it should be available to the health sector and other sectors who need it in terms of planning and setting policy and so forth. They have this data as available at their fingertips they can use when the time is necessary. We also see the need to develop human resource and capacity, meaning bring them up to a level of professionalism, train them in terms of data handling and of storage, data handling, storage, and so forth. So we must have staff that knows what they're doing and how they're doing it, right? So we see a need for training when it comes to data collection and so forth in different sectors of health. We believe that there is a problem, and a problem to deal with persons not aware of their roles in terms of in the health sector and the impact of the job, meaning that they're not aware in such a way that they do things, I want to use some local terminology, Vike. They do things anyhow. And it could distort data collection. And it kind of piggybacking on the development of professionalism and so forth, but we think that there should be more workshops and more training to these persons so they could be on par and ready to do what they need to do in the health sector. We believe that there must be intersectoral and sensitization of health challenges, tongue tying up at the eat again. We say we need intersectoral, we mean that there must be cross and linkages formed with different ministries and different organizations. And they must be on gear in mindset of health, meaning that when they're creating policies and so forth, they must know that it's coming from, they must know that their policy could have implications on the health sector and climate. So we identify that some of the ministries don't work in collaboration, and due to that, we are behind a lot of things in terms of health challenges and climate. So, for example, you might go to the Ministry of Works and you find out that they don't really collaborate or touch tab with health to find out, well, okay, we're gonna build a road. What is the effect you have on the surrounding environment with the dust and the so forth and the pollutants? Because the sun is dry, the sun is hot and the mud is dry, so it's dust. So what is the potential hazard you could have? So there must be a cross-link in when dealing with these policies development within the ministries. We also, and lastly, we also believe there must be standardization. And this means that they must have a certain standard, a certain way that we do business. It's not just business as usual. We must have this the ministries and especially just going back, ministries and so forth must work at optimum level and share information. And this must not just be, okay, we're saying it today, it must be a standard set for the future, so it's adherence. So you have this adherence that this is a policy, this is a protocol when we do things, these are the people we relate to, and this is how the information must be disseminated and shared when we think of creating policies and doing development. So we did identify those gaps, and hopefully sharing it to you, you'll be able to put you in a better position in creating the document. Thanks.
Okay, thanks very much. And just on a point of information here, not trying to defend anything, your first point on the registry, there's an epidemiology unit that does a lot of this kind of work. It doesn't do it at the level of detail. I was listening to your discussion here, which we have here, but there is something which to work from in terms of data collection and archiving and so on. No, I agree with you on that, yeah. Yeah, I'm not saying no, it's just that when he spoke, it came across that there is absolutely no data being collected. And I think we need to acknowledge there is something, but we need to strengthen it a lot more. Okay, group number 3.
Hello again. Okay, so for question number 2, in terms of gaps in the analysis of Grenada's health system's capacity, what we identified that there's a lack of coordination of the support services. So we found that there should be an evaluation of our support services to the health services. So for instance, agencies like NADMA, even with our police. And so again, we looked at the gaps, or we looked at what was missing from the COVID pandemic and the way that we responded to it. And what we stated is that there should be a review or a distribution of the different lessons learned from emergencies from the past, so that we can create or we can implement policies for future events, right? So we can create policies for future events. Also, we saw that there was a lack of coordination. I said that, sorry. Also, the collection of, what we noted as well was the collection of finances to support health as well. So for instance, with our national insurance scheme, we also know that that we were looking into the national health insurance as well. So how can that support health? Also a pay if you can. What we noted in our discussion and from the concept note is that only 5 to 6% of our budget is allocated towards health. So how can we create, get more money, get more funding for health so that we can improve on these systems? And then in turn, I guess it can improve with the coordination with other agencies as well. Also, one of the things that we noted was that of insurance in terms of climate change, and we look at occupational hazards, and so persons who are more at risk would, let's say an insurance company, would they provide support for persons? Would they offer policies in the event that they incurred some sort of disability on the job and they can't work anymore, or premature death? We also highlighted the need to improve on our primary healthcare systems. Again, we would see with climate change, the projections show that there'll be an increase in respiratory and cardiovascular illnesses. So what do we have in place right now? How are we encouraging persons to take care of themselves or to protect themselves, to prevent or to limit the prevalence of these diseases? Also, in terms of support with the support services, we noted that there should be an understanding of the mandates of these different supporting agencies. What are they really required to do? When do they come in the event that we have a disaster or an emergency? What is the emergency response plan? And is it being updated? How often is it being updated? And is it distributed so that everyone can be aware of it? Also, in terms of sustainability in the health sector and our response to climate change, how sustainable is it? Is it long-term, or is it just within a short period of time? And then also lobbying for international financial support to be able to support these different sectors and their collaboration and the cohesiveness also.
Thank you very much.
Okay, good afternoon again. For question number 2, we thought that a comprehensive vulnerability and capacity assessment of all our medical facilities, all our medical centers, and so should be conducted. And from that vulnerability and capacity assessment, not only we can see whether our medical facilities can stand up to adverse weather conditions, but also from that assessment as well, we can gather the extent of training that needs to be provided to medical staff in the area of climate change and so on like that. We think that that would be important. Modernizing the data collection system, as was mentioned by other groups. We should seek to have a modernized, robust health information system. Of course, look at standardizing the data collection, whether we follow PAHO or WHO standards. And of course, providing training to our medical personnel in data collection and collecting the data that is required. Also, review, amending, and enforcing of relevant laws and regulations required to make our health system or health sector more resilient to the impacts of climate change. Thanks very much.
Okay, thanks very much. Okay, and it's good to see that a number of you have gone beyond just identifying gaps to actually providing recommendations. So we can actually take a look at what needs to be done to move forward. Anybody who has any questions for any of the groups? Again, the groups took slightly different angles, which is good. It gives us a broader spectrum. Do you have a question?
No question. I just wanted to add a point. For question number 3. Sorry. One of the points that I forgot to add is that we need to adapt a systems thinking approach in whatever it is that we do. We can't just sit and say, okay, we're focusing on health alone, but we're not considering all other factors that will affect health. It makes it easier. We're then able to identify the supporting services that we will need at that point in time, and it makes it better. We're able to yield results at a faster rate.
Okay, thanks very much. Any other questions for any of the groups? Okay, let's move on to question 3. We'll do that wrong, and then we'll do 4 and 5 together because the questions 4 and 5 are almost similar. Question 3, I think the question has to do with projects in other sectors which have an impact on health.
Right. So for question 3, I just want to know that this one's a bit of a tricky one because we all represent in different sectors. So it's essentially we're given the opportunity to kind of look inward and criticize what we may be doing in our own sector. So I think this is a question that should be probably done through another angle, just in case we're too biased or don't want to put out our practices that be the one to call out some of the things. But this is a great one. So we kind of look at policy/practices because we don't know what the exact policy documents would be. We mentioned increasing marine activity and the impact on the environment, increase in tourism development and the reducing of green spaces. we looked at how land policies, land use policies, and land use practices are really impacting what we do. So what is being given permission to be built where, and how different sectors or private entities are able to use specific land. We all, one of our colleagues mentioned early on in the discussion about the removal of a lot of our mangroves and the impact of that. So taking a closer look at land use practices, policies. And even our debushing practices, something as simple as that, the removal of some of the vegetation that is quite important in keeping some of the soil together, and how that has long-term impacts later on. Collection at health facilities that can't be immediately flagged. And I stand corrected here, and I'm piecing this together from discussions we had at our table, and perhaps I probably got this wrong, because it's not a point really that they identified, but I think it's worth mentioning here. For instance, 10 people from the same manufacturing plant show up at 10 different health facilities throughout the country. There's no way to immediately flag that these persons may be presenting the same rash or the same symptoms that may be telling of something that we need to track immediately. So things like that. So or data collection practices at health facilities, public and private. And that goes to what we were all saying in terms of centralized data management. And at this point too, nurse, I might need your help. The current centralization of the general hospital and how that, the recommendation here was a decentralization of the general hospital from the Ministry of Health, and how that separation of the actual practice, the health practices from the ties of governance and the implications for the mobilization of finances that may be needed at the health facilities. So I might have butchered that because I have no idea what that really entails, but it's a point that Thank you.
Okay, thanks very much. Very interesting presentation. Group number 2, what's happening in other sectors and in your sectors that could impact on health?
All right. For question number 3, our group were able to identify. Oh, you can't hear me? Hear me now? Good. So we are able to identify several instances of climate change adaptation policies where it could cause it could pose a health risk. We were able to identify one with the tourism sector, but I want to go a little further because it might be Ministry of Works. They might have some little contribution to that too. So tourism/Ministry of Works, where we see the practice of water relocation. So they're taking water from one community, one specific place, and reroute it to a separate place. So like they'll take it from Anadale and send it down to Grenada. And what we discover with this is that it eventually affects the surrounding community, means that they are left with low water reserves for their agricultural purposes, their use, their community and the people. So we think that they should look into that, find ways of mitigating that challenge and be a bit more social responsible when making a bit of do some projection to see if they could make sure that that risk, that doesn't pose a risk on any emerging community in the future. Also, we look at housing, specifically the Chinese type housing system that's, oh boy, I'll get backlash on that. Well, that means everybody's aware of this one. The housing solution, the Chinese type housing. We realize that there's some social ills, meaning that the type of accommodation and everybody is cramped up in that small grouping, it can lead to social ills, meaning that crime and so forth. It could bring on stress because Grenadians generally are accustomed with the yard space and putting up the foot on the veranda and so forth. And without that, it could be some problems. We also notice with that, there's no provision for facilities like for exercise and recreational type activities. So they didn't consider creating facilities for the residents to use to get a little exercise and so forth, even to go. Oh yeah, I was reaching them earlier. You know the thing while telling them. So we also identified that there's lack of green spaces as well, right? So the persons are in that housing facility, they don't have that area to go and be one with Mother Nature, you know, and that is important. So we should look at if we providing these types of housing arrangement, we must consider, you know, providing the green spaces and the little things that make the human mind at ease and live peacefully. So those are the two. No, sorry, we had one more. We have the negative effect of tourism on the environment. And when we speak about negative effect, we think about some hotels might have bad practices of inconsiderate disposal of waste and so forth, and waste management and the environment as a sea. And remember, we're thinking about the turtles and straws and so forth. So they may dump the waste, the food or the chemicals into the sea, and we think that it should be one, we should create policies to mitigate against that. And if there is policy, there must be enforcement. That's what I'm looking for. There must be enforcement to ensure that those policies are being adhered to. So that's our contribution on this question. Thank you.
Okay, thanks very much. Number 3.
Okay, so for question number 3, so the impact area is the awareness among sectors. And one of the things that we noted, sorry, let me gather my thoughts. Okay, so for one of the things that we noted is that, for instance, our water company, they proposed to upgrade their Concord water treatment plant. So with the major rehabilitation of their water supply, it can pose risks to different sectors, for example, tourism, access to healthcare, and so. We're talking about if they're running new pipes and so, then that's displacement of some cutting down of trees, so a bit of deforestation. Also, water can become contaminated. That can pose a risk to health. They provide us with great water quality, mind you. But there are different things that can happen during that process, during that phase, and it can impact health. Then what we noticed is that we need to build our occupational health and safety regulations or guidelines. We possibly do have in terms of do we follow them, are they enforced? That is one way that we have to create awareness among our sectors. In terms of climate change, we're speaking about persons who are working not just outdoors, but another group mentioned indoors, right? What are the conditions that they're working under? Is it conducive to their well-being? How can we improve on that? Because persons are within their workplace for most of the day. Also, we looked at sewage management or waste management. How do we manage that? What do we have in place to manage our waste? We know that we've been doing open burning. What can we do in future to reduce on any sort of emissions that go into the atmosphere? How do we manage the waste that goes into our waterways, right? That can pose a risk to health as well. If we have blocked drains, if we have debris going into the oceans, that as well pose a risk. Another is that of emissions from vehicles. We're seeing that we have a lot of vehicles. Yes, we're on the way to regulating or reducing on the amount of older vehicles that we have on our roads. But what are we putting in place to manage that? There's a lot of vehicles on our roads, a lot of emission. Are we going to be given incentives for persons to walk more? The previous group, they mentioned green spaces, right? What are we putting in place so that we can do that? Because if we put other incentives in place, so we have better roads, better sidewalks, we're encouraging walking, then we're going to see that there would be an improvement in health and well-being, okay? So in terms of, I'm just going to read from my paper now. So in terms of reducing the risk of the impact on the health sector, we have that there should be rigid occupational health policies, which I'm sure we can all agree to. The health impact, so we should have health impact studies on the policies across sectors. So what do we have in place? How can we improve on them? There should be major public awareness and communication. I'm sure a lot of us, we don't understand what should be done within the workplace to ensure that our health and our well-being, or even in classrooms, right? How can we improve on that? That affects health in terms of fan, in terms of ventilation, all of that. Also to create legislations that would support these policies that we're proposing. Also, there should be integration among several sectors and improved communication, and that will come along with training and consultations. Thank you.
Okay. And number 4.
Okay, so for question number 3, one thing that was discussed in our group is the fact that we don't separate our garbage. So not looking at any specific major project per se, but looking at this practice that we have of where we send all different types of garbage to the landfill at Perseverance. And we saw what had happened in the past with one of the landfill sites there with fires and so on like that. So, and with the projections of increased temperatures as a result of climate change, with us sending all different kinds of garbage to the landfill with a risk of a fire starting, and you have all different types of noxious gases being released into the atmosphere, and so that's something that we should seriously look at. We know that that particular site, the landfill site at Perseverance, is abandoned now, and they're having a new one. They're doing a new one on the other side, so let's hope that things will be done different. But in terms of the garbage that we send to the landfill, it's still there. We still don't do any separation of garbage. In terms of tourism projects, and so we have seen cases where mangroves have been cut down or destroyed, and we all know the importance of mangroves, for example, in preventing coastal erosion, and with the projections for increases in the sea level, that's something that we need to look at seriously. In terms of agriculture, of course, we would have to look at some of our farming practices or use of fertilizers and pesticides and so on like that. And if we have periods of heavy rainfall, we know what that means in terms of leaching of those agrochemicals downstream, down the rivers, for example, and then into the sea and so on like that, and the implications of all of that. So these are just some of the areas that we wanted to highlight for question number 3. Thanks.
Okay, thank you. Does anybody have any question for any of the groups? On sectors, other sectors? Yes?
The issue of housing is not just with the Chinese houses, but with general thing. I think generally the housing projects that government undertake. I have personal experience of living in an oven. People are getting in an oven. People are getting sick where I live. We have sewage problem there for long years now, and you know that, but that is not so much a problem for us as the heat. From the time maybe before mid-morning. Yesterday I was shocked. My keys, which is on my desk, was heated when I pick it up. Thanks.
Okay, thanks.
How are policies creating everything? Housing is good, right? Water is good. Why we need houses, and we have building codes, so those are positive things as to how we should build a house to prevent hurricanes, if we have earthquakes, all the rest. But even in doing so, where the houses are put, a lot of the other codes are not followed, the bigger codes that are required. And that is where the challenge comes, because people go according to what they're supposed to do, right? You tell them you have to put X amount of concrete, your foundation has to be there, but then we build houses. Every time I drive through St. David's, I cry, because all I see is one big rain and everybody slide down. But no, I'm serious, but we need to have proper housing solutions. That's why I call it housing solutions. But are the housing solutions going to be the bane of the existence of the people in the community? And those are the things we have to take into consideration.
Okay, thanks. Anybody else wants to contribute on that question? Yes, Dr. Marston.
I was thinking, if we have a policy of encouraging tourism to the extent that we realize that mariners could be very beneficial, but have we thought it through? I mean, what is happening to the workers at the marinas, the type of chemicals they're working with, and the disposition of those chemicals in our waters? That is something I've been sort of thinking about. So this whole tourism is linking to health of the actual workers.
Okay, thanks. Point noted. We have rapporteurs around the room who will be taking all these points. Okay, anything else anybody wants to raise on question 3? Okay, so let's move on to the, sorry, Hayden?
Just a moment to add something that just came to mind. About 2 years ago, I coined a phrase that was our annual scheduled oil spill, Juve. An incredible environmental impact, health impact that has not been investigated, where Grenadians are all collectively responsible for a national oil spill of carcinogenic toxic chemicals that we bathe in for 6 or 8 hours and then dispose of everything within the environment. So the policies of the tourism and the other ministries do affect the environment and the health in here in an unknown manner.
You're supposed to be a land of 100,000 jobs, right? Okay, we talk carnival another time. Okay, so we have one last round of questions. And I suggest we do question 4 and 5 together because one links to the next. What measures and which are the priorities? So we'll, if you don't mind doing both together.
No problem.
Then we'll move on from there.
Before I do, I really do appreciate this dialogue that we're having. It allows us to interrogate our own selves. Because ingredients like job, but that it really is something for us to take a look at and all the other things that we've been discussing today. So thank you for this opportunity. So we are at the point of recommendations. I have 5 with 2 additional desired outcomes that we weren't able to get all the other categories for. So the first objective, I should start with what I think my group would agree is the priority one, and that is to strengthen the data and information system for management of climate-sensitive diseases. And the first adaptation action here would be to develop and implement a harmonized and integrated national surveillance database for the recording of impacts and risks of climate change. The second action under this would be to develop and implement an intersectoral research agenda on climate change. And the third action under this objective would be data collection directly after adverse climatic events. And the desired outcome here would be more evidence-based planning and policy development. The second objective would be to increase capacity of the workforce, and this specifically the health workforce, and support services to effectively address climate change impacts and risks by 2035. We've been ambitious, or maybe not, some would agree not so much. And the first action under this objective would be to recruit, train, and retain healthcare personnel in general and specialized areas. The second action under this would be to update and modernize laboratory facilities and services. And the desired outcome, improved primary, secondary, and tertiary healthcare delivery in the entire state of Grenada. The third here, to improve food nutrition security, especially among vulnerable groups by X date. We haven't come up with a particular date. The appropriate actions under this would be to produce climate resilient plants, to increase production of climate resilient plants, and the implementation of more climate smart agriculture practices. And the desired outcome would be to ensure food security. The fourth, to improve resilience of healthcare infrastructure. The action would be to implement climate smart construction practices, and the desired outcome, to reduce the response and recovery time after negative climatic events. The fifth focuses on climate change knowledge of citizens to be increased by X amount, by X date. The appropriate actions, public education programs via various forms of media, and involving wide cross-section of persons, particularly the lay people, the people on the ground, as you would normally say. And the desired outcome here would be to improve the quality of climate change-related practices in our day-to-day lives. And 2 other desired outcomes unrelated to the previous points, to somehow see how we can benefit from the adverse effects of climate change. It's happening. So for instance, increased temperatures, how can farmers use that to dry products that they need to dry? It is happening, so we might as well find ways to make use of it. And as one of my colleagues was talking about, the project that was done in River Road and the high walls, and he was just thinking, what about if there is a blockage lower down? We would have essentially increased the force of the water coming down. How could we use that power higher up to do something? So I don't know. We know the impacts are coming, they are here. How can we make use of them as they're there? And the last is to expedite the passage of any laws, policies, whatever, is being backed up wherever in government, waiting to be passed, that are directly related to climate change, adaptation, and mitigation practices. So that's it. One of my colleagues have something to add? All right, so again, another way that we can utilize the adverse effects, so, right? Thank you.
Check. We got it. Okay, thanks. Okay, group number 2. Same thing, priorities and other recommendations.
All right, once again, my phone just notified me that I had made my daily cardio steps. So this forum was good for my health. So just to address the last 2 questions, we have some areas we would like you all to look at. We believe some of the mechanisms that you could use. Importantly is the climate change agenda must be part of all policies in each government sector. And just give me the opportunity to go in a bit in depth. And when I say it must be, climate change must be part of all policies in each sector. We know that now, this government, the current government, have agricultural agenda to bring agricultural reform and make agriculture the main product of Grenada, or to bring to some standard up and to feed ourselves. Yes, we do welcome that, but we also must be mindful, because if we're going to increase the agriculture sector, we have to think about utilization of fertilizers, how close to water sources are getting the lands and so forth. All these things policies will be needed to create that boost, but we must keep climate change in the back of our mind. What is the impact for development? There must be something to mitigate that. So we don't want to, yes, on one hand we benefit for more produce and manufacturing, and the second part we're losing crayfish and thing in the river because fertilizers are being dumped in the river and clean water sources are being contaminated. So we believe that climate change must be part in all policies in government sector. There must be some collaboration in dealing with the policies, especially the Ministry of Health, so it could do cross-checks and so forth to ensure that it wouldn't have a negative impact on climate and also on health. We believe that there must be well-defined legislation, because as much as we could talk here and have these policies and so forth, if there's nothing to enforce it, you would just end up on a shelf. And that's not what we want. We want legislation so persons can adhere to the practices that we are speaking of and ensure the future that we want to see is secured. And not just legislation, just to say we put it in the law books, but there must be some type of enforcement to ensure that these laws that will be created are adhered to. So we think that it is also integral that while we create laws, there must be some way to back it up, and there must be enforcement in there. We see the need for a shift in standards in human resources, meaning that the human resource department must be educated and bring up to par on standards for climate, especially not just for government workers, but for other sectors. There must be this training and sensitization on the climate, or the environment, not the climate, on the environment and preservation of the environment and practices and so forth that we want to see, the changes we want to see as Grenadians taking care of our environment. So we don't really leave that footprint for children to deal with. Just to say, the group and I, we were talking about 2080 and see some of us will be dead. And one pointed out, well, I will be an old man. But I say, well, I will be an old man, but I wouldn't be able to, I won't have my senses to realize what's going on. So grandpa on fire and grandpa don't feel it. So these policies are them is really for the young ones coming up. So we must take up the responsibility and ensure that we have this development and this sensitization throughout the Grenadian public to be on par with what is happening with climate change, and this thing is not really taken for a joke, but serious. We believe that there must be a level of education in schools, because we just spoke on the topic of the young ones and they're coming up. So we must bring the students, bring that information to students, let them know how to take care of the environment and the policies we want to work on and the practices that we want to see them. And not only them, but we as adults too, the practices that we want to see as responsible Grenadians when dealing with the environment. So that's one of the measures we think about putting into, well, not think about, we agree on putting inside it. Early education, whether you cross-link it with HFLE, or you cross-link it with geography, or just have it as a standalone subject. There must be some sensitization in schools in bringing the students up to what is happening with the environment and where we want to be before 2080 reach, and I have to burn. We also think about the capacity and training, and good staff. We must have not only trained staff, but we must have adequate staff in the different sectors to deal with data collection, implementation, and other policies and resources when it deals with climate change. So that was the first part of the question. As 4 and 5, our recommendations that sustainable development goals must be included. And when we say sustainable development goals, we speak of the end of poverty goals, end of hunger, provide good health care, education quality, empowerment of women, girls, climate change, and climate action, and partnership. And we want to emphasize on partnership because the public sector cannot do it alone. So we must partner with the private sector and other NGOs and so forth to come on board and take this thing serious. So partnership, we want to put 2 exclamation marks by partnership, highlight it in yellow, blue, green, any color you want, bold it and underline it. It must have this partnership component when it deals with climate change, because we alone can't do it. We speak of, well, yes, just to reiterate, climate change should be a part of the school curriculum, and education is the only way we're going to combat this thing of climate change and keeping the number low. As what was the number again? 1.5. We want to reach to 2. So you see, I was paying attention this morning. Right? We also speak of cross-fertilization, inclusion of health practices in all ministry. So just to give you an example, like we have cleaners coming in and they might clean the ministry, and we want to ensure that they know the practices of not just throwing anything down in the sink, but discarding the chemicals and so forth in a responsible way. So that's just one example, but there's a lot of multi-branch tier system you could go out to, but also we think that there must be a focus on the inclusion of health policies in all ministry branches. And I would just go a little further and say it should be in all sectors, even in the private sector. Just go a little further and say that we, on the responsible partners, especially the private sector, must adhere to these policies as well. So you see where legislation comes in. We see the need for a more clean and potable water system. I know we have a representative here from NAWASA. I hope they'll take that seriously and go home with it. And then there must be budget allocation and accountability for budget. So we must provide the resources, because these things don't happen by magic. These things cost money. We have to get funded, and we also need to allocate budget in terms of dealing with the climate change and the effects of health on climate change. And not only providing the money, but there must be some mechanism or reporting to see how the money was spent and ensure that it was used for what it was intended to be used for. So these are some of the solutions and contributions and et cetera, et cetera. Yes, I know you want to go. We're going now. So thank you very much.
Okay, thanks very much. Group number 2. And I find it interesting that a lot of the recommendations I'm hearing, I think you made a point, wouldn't be applicable only to the health sector, but in fact could go across a number of sectors. And it's something, Dan, you probably need to just take a note of, because we probably could export some of them into the NAP itself, the broader NAP, and don't just restrict them to the health sector only. Okay, so thanks very much. Any questions for group number 2? A lot of emphasis again on the enabling environment and on capacity building, which is what we would have heard also from group number 1. Yes?
One, it is that we need to make climate change everybody's business. You know, we were told years ago that tourism is everybody's business, but climate change is really everybody's business now. That's one. And the other idea that came out from one of the members of the group, that we must be the change we want to see. Thanks.
Okay, thanks very much. And just another point, you said climate change is for the 2080s. I think in the, yeah, but climate change is with us. It's happening. Oh, okay. I thought you were saying it wouldn't happen until you become a grandfather, so it's not a problem. Okay, good. Group number 3. You're going? Pardon? Sure. Although for the camera, it's better if you do it up here. We're recording it, so we could use it in the future.
Okay, in terms of the recommendations, the impact area that we have is the data management. And what we stated is that there should be an establishment of a comprehensive national data management system. In terms of adaptation actions, so we have specialized human resources. So we identify the different key areas that we need to specialize in, and we would create, let's say, scholarship opportunities in terms of our, let's say, curriculum in schools. And so we tailor it to suit what's needed. Then another point that we have here is data collection Sector involvement, so all sectors should be involved in terms of the data management and data collection. We need to see some sort of cohesiveness there. Also increased technology advances. So for example, we do have telemedicine here in Grenada, but to see an improvement in it or advancements, so for example, the use of robotics, that's a recommendation that we like to make. We'll make some more in a little while. And what we'll see with that is that it's going to build sustainability within our healthcare system. And again, ways that we can do that is through training and also by improving on the equipment that we have available.
The other areas we would like to see improve in health, I might be a little biased because I'm a nurse by profession, is that we would want to see upgrading of all our health facilities throughout the island, not only Grenada, it should be Carriacou and PT Martinique as well, making sure that all our health facilities is smart facility, not only in terms of climate smart, but in terms of the type of equipment that we use and so forth, so that persons that we care for would have access to be able to, see them and take care of them more faster. I would like to see, all of us would like to see that healthcare should be the #1 priority, because a healthy nation is a wealthy nation. If somebody is not feeling if somebody is not well, they would not be able to adequately do their job. We would like to see an increase in the budget for healthcare. We would also have to look at in terms of where our main hospital is. We would have to think about putting our main hospital somewhere else, because as where it is now, we have the sea is right there and we have erosion and so forth and stuff like that. So we will have to think about another area for our main hospital. And also not only that, on our mornings you see the congestion at St. George's in terms of when persons have to access for care in an emergency. It's very hard to get to our hospital and so forth because of the congestion of our vehicles and so forth. Also, we would like to see we have in a national school of nursing, a government school of nursing, so that we'll be able to always have the amount of nurses that we would like to have here. We talked about brain drain. We have been losing a lot of our nurses for many reasons, going overseas and so forth. But if we have a national school here, we'll always be able to have persons who would be going into the field of nursing and so forth. And if we are looking at that, we also look at retention, recruitment, and remuneration of all our healthcare workers. So not only nurses, our doctors and so forth, or auxiliary staff and so forth. We have to provide incentives for persons to come into the healthcare system. During the pandemic, we would have seen a lot of persons who would have left our health systems because of the impact of the mental issues that they would have had for their own self and so forth. A lot of persons lost because they realized that the job is very stressful and so forth. And we're seeing that persons now are thinking of beyond that they can make money easier in other areas. So we have to ensure that we make it worthwhile for persons to want to come into the health profession and so forth. So we must make it lucrative and attractive. In terms of our education, we have to start I would even say from secondary school, we might have to start to teach children from pre-primary schools. We will have to think about starting there to educate persons about climate change and so forth. So that by the time they reach my age, you would be able to easily understand and know exactly, what will be occurring and so forth. Also, in terms of technology and so forth, we must look at telemedicine, as my colleague now stated, because, for example, because we know that many of the specialized areas, we don't have access to it here. However, if we have telemedicine here, throughout for the different health problems that we may have, somebody can be here and we might be able to speak to a doctor, a specialist in another island, and discuss the case that is happening here. So maybe make it easier. Instead of the person might have to travel for the care, they may be able to stay here, but because of us discussing with persons overseas and so forth, so it might cost them cheaper, and that's a way of improving our healthcare system. In terms of our
Okay, so we do have some editorial notes or some suggestions, but we'll provide it to the panel. We're not going to share it here today. Okay?
By going through the document, you know, we saw some of the things that
we saw some things
that should be, you know, edited and so forth.
Okay. Thank you.
Thank you.
Thanks very much, and thanks for the editorial assistance. We appreciate it. Okay, any questions for this group, group number 3? Any reactions? Yes, Dr. Marcel?
Yeah, I'm wondering if we're making it clear that in our health system, the importance or the exceedingly relevance of public health as against, you know, just the total health system. Because, you know, public health tend to zero in on preventative. Let us start, you know, up front, and then we could do the medical part.
Okay, I think that's a useful distinction which we'll take note of. Okay, so our last group, group number 4. Who's reporting? Oh, you're reporting. Yeah, he's going to the front. And then after group number 4, we have one person online who has asked to make an intervention, Ms. Sandra Ferguson. So we'll go to her after group number 4 finishes.
All right, pleasant afternoon to everyone. All right, we decided to change the face for group 4 at this point in time. Will the lovely members of group 4 stand so everybody can see you? Lovely people, yes. All right, so we're down to the final 2 questions, and the thing about it is that the priority that we have here might seem a bit biased because I'm a police officer, but most persons mention it. It's the whole aspect of updating legislative framework. The truth about it is that a lot of things that we do here in Grenada, we sign onto a lot of treaties and so forth, but we do not have the legislative backing to deal with most of these things. And a lot of the times we say we need to do this and we need to do that, but at the end of the day, do we have the authority to do it? A lot of times we don't have the authority to do it, and this is why we believe that this is priority, right? And what we, in terms of adoption actions, we believe that you should revise and amend the current laws. There's a lot of laws in the books that really don't make sense, to be honest. There's laws in the books that speaks to someone shaking their mat in the tongue and those type of things. Have you ever seen anyone arrested for that? Right? At the end of the day, you want to make those laws relevant and enforceable. Because a lot of persons spoke about the mangrove, and we spoke in our group the whole aspect of zoning, a problem that we have, because I'm representing the Police Welfare Association here as the chairman. However, I'm attached to the fire department. And we have seen a lot of reports coming in of persons having coal pits in residential areas. Now, when we get out there, that's an issue for us because prior, when they zoned the areas, these areas were agricultural lands. But people come now and they build houses in those areas. So the persons who are making their livelihood through the burning of coals now is causing issues for these persons, and a lot of these persons have respiratory problems. But do we have any teeth to deal with it? Because we have no legislation, we're more back than bite. Right? I can't just go out at someone's coal pit because they're actually in an agricultural area, right? Not a residential area. So that is one of the things. If we update our laws and we zone properly, we would actually alleviate that issue. All right, so that was the priority. As I said, it might seem that from my end. All right, we also looked at the whole aspect of upgrading our medical infrastructure. My friend early on spoke the aspect of doing a vulnerability study and also capacity survey of all medical facilities. According to him, there is this SMART initiative with 16 facilities, but there's over 30 facilities, so we want to see that happening in all facilities. The whole aspect of access to all persons, differently abled or so forth. When you have a national emergency on a national scale, you have a number of persons coming, and then we see from our end, how do you get to those facilities? And secondly, would those facilities actually stand up to severe weather? Right, so we need to ensure that that happens. All right, thirdly, a lot of persons spoke about it, the whole aspect of educating, informing, and communicating with the general public. We need to have the general public buy-in to what we're doing in terms of climate change, right? And what we want to do is not just the conventional methods of going out and community forums and outreach and so forth. What we realize is that a lot of times you go out to do these things, you're speaking to the converted. When you go out there and you go out with a Lord Hill and you say, okay, we're going to have forum and climate change and those type of things, the persons who would actually come out are, you can speak to the whole aspect of all the NADMA persons in the communities coming out, because I have gone to do fire prevention programs, and when we go there, we have 8 persons. When you ask where you're representing NADMA, and maybe 2 elderly persons. The persons who actually need to get the information, they don't come out, right? One of the persons in our group spoke the whole aspect of maybe having a fun day, and in between you inject those things, so then persons would come out and they'll have more buy-in. I remember one of the groups speaking the whole aspect of from the school level, and I believe that is where we can reach most persons. These persons would go home and actually speak to their parents. The parents would listen. However, you also breed in a new generation of actually climate change conscious citizens. And as you become adults, you will teach your children, right? Fourthly, we went with everybody I think had that similar suggestion, the whole robust modernized data collection system. And one of the things that we want to ensure is that you have continuous training of medical persons. We believe that if you do work and it's not recorded, then you didn't do work, right? And when you as the persons, Dr. Walters and so forth, go out to do analysis, and you have persons in those medical stations and so forth who are not collecting the data, they're not recording the data, you do not have a true reflection of what is happening out there, right? And we need to have that, right? Because only with true data would be able to have reliable analysis and reports that would actually lead us to have policies and legislative change that would actually aid us in this fight against climate change. All right, person spoke again about the upgrading of labs and medical facilities. We look at the decentralization of key medical services from just the general hospital. Well, one of the persons were from Carriacou, so you know that would be a big point for them. We want to ensure that persons can get access to all these things all over, right? Because we want everybody to be able to access medical services. And one of the big points for me is greater collaboration between all stakeholders. We need everybody on board. I think Jaron spoke about it at length, right? And what we're looking at is development of standard operating procedures and terms of reference. In some instances, we also need to activate some of these existing committees. We have committees in place, but to be honest, a lot of the persons who are on the committees are there ceremonially, because they actually came into a position, so I became the officer in charge of this, I became the deputy director, so I'm on a committee now. What is my portfolio on the committee? What am I supposed to do? I have never heard about this committee before, so I go to a meeting and I report, but I have no ideas because I don't know what the committee is about, right? We need to activate these committees and make sure that persons understand their roles, and when you go in there, and that's the whole aspect that someone spoke about it earlier on, succession planning. If I'm coming up and I know in the next 2 years I'm going to take that position, I'm supposed to know what that position is about. What committees would I be on? What would be my role in these committees? And unless we have that, we would not see a change happening, right? And the whole aspect of development of smart work plans. We need to have work plans. A lot of times we come and we just doing things, as Jaron correctly said earlier, and vike. We need to have a work plan, not just a weekly, but most of the time you have a quarterly work plan. So you know that quarterly you have meetings. So when you come, you have to have a quota that you had to meet. If you don't have these work plans, then we achieve nothing at the end of the day. All right? And the whole aspect of improving response to calls for service. Right? Calls for service, persons call, especially in cases where you might have someone, we spoke about a heat stroke, or hypertension, we spoke about dehydration and so forth. Persons calling for that response, and then you have that delay response, right? If we do not have persons a standard operating procedure for responding, right? In the fire department, we have a standard operating procedure that once we get a call, we're supposed to leave the station in 2 minutes. Does the ambulance have that? What is the time for them to leave? Right? And then you need to have a dedicated hotline for the ambulance service. If you're calling the normal line that someone is calling to make an inquiry about an x-ray, about somebody that's on a ward, every time you call, the line will just ring out. Right? You need to have those dedicated things, and at the end of the day, we'll have timely response, and we would actually be able to save lives in the whole aspect of climate change. Thank you very much.
Thanks very much. And it is interesting to see how many of the groups have come back with almost the same recommendations. Legislation, data collection, human capacity development, infrastructure. So we've seen quite a bit of convergence in addition to the additional points, but we've seen a lot of commonality between what you recommended, which is good in that we're developing a consensus as to where we want to go. Okay, I said we have one person online who wants to make a contribution, so let's get over to Sandra. Sandra, can you come in, please?
Hi, good afternoon. Can you hear me?
Loud and clear.
Good afternoon to everybody. And I'm representing the Agency for Rural Transformation, Arts, and the Interagency Group of Development Organizations. So I just have a few comments to make, observations. Some of it may be touched on, may have already been touched on during the comments, the presentations and comments. The first thing I wanted to look at is the issue of mental health. And I noticed that the document said diffuse effects. I do not agree that it is diffuse effects. I think that it is a very direct effect, which we are beginning to feel, be aware of more and more. I think I heard at least one colleague suggest that. And I just want to also indicate, bring in here the issue of road rage. When you are traveling along and you get stuck in traffic or whatever it is, in that kind of heat, and the issue of road rage. And I experienced that a long time ago, the year after Ivan in Barbados. There was a building boom and it was the morning traffic. And, you know, it was just the tension and so on. And you realize the heat. So I want to suggest as well, and that was also mentioned, the issue of building and housing. And therefore, if we're talking about climate resilience, our housing building codes and the standards will have to change to also address the heat element. And therefore, other organizations, institutions involved in that, of course, the Physical Development Authority, Physical Planning Unit, the Ministry of Housing, Housing Authority, the Engineers Association, etc. Now, I also want to say that heat is exacerbated by the slaughter, what I call the slaughter of trees, land clearing for building, development, housing, and also for roads. And the importance of trees, I think we can see that, those of you who have traveled to Toronto, for example, you can tell how old a certain part of the city is by looking at the height of the trees. In fact, when you look out of a window on some level, sometimes you can't see anything except trees. If we're walking along the road and we hit a little part where there is, just think about going up the lane, for example, the part where there are trees and further up the lane. So the issue of trees and the planting and replanting of trees and the conservation of trees when we're doing certain work is important, including on the roads. Now, in terms of the response of the Ministry of Health, because we're talking about a health plan here, and if we're talking something like mental stress and other diseases and other health impacts of climate resilience, of climate change, that has to fit into our health system. And most important, certainly from an NGO point of view, is the whole issue of preventative and primary health care at the community level. So I want to suggest, and I want to say I'm borrowing this from Dr. George Aline. I read this in a Kajana's issue some time ago, which I still have somewhere in a box. But he spoke about training, and I also want to put in here that, remember, Grenada has a high incidence of non-communicable disease. And part of addressing that the preventative, certainly at school and community level. And therefore, the role of community health auxiliaries, or what he also referred to as health extension workers, and therefore integrated into their training as well could be the issue of the impact of climate change and how to address certain issues as it relates to health and other things, because we need to see this in a holistic way. We talked about, reference was made of a technical committee. And I want to suggest that probably we need a second level committee, because there is importance in having regular dialogue, exchange of information and engagement. And maybe information from that committee could be fed up to the technical committee. Because in that committee, you would have people who are less health, not in the technical areas as related to health, but in other areas. The role of NGOs as well, because the EDF, the EU 11th EDF, which I think just came to an end, also supported non-state actors in terms of delivering certain community health services. Okay, in terms of building capacity, we have a number of, and some reference was made to the SGU in the document. We have a number of scholarships that offered to attend SGU. How does this fit in? I am not sure about the School of Nursing now, whether in fact that is now the responsibility of SGU. But I just want to make an observation. And I could be corrected. But I think in the system that Grenada has traditionally followed, the nurse is the pillar. The SGU is an American university, and I think its standards are American. And therefore, the status of nurses in the American system is lower than that in our system, where basically the nurse is boss. And particularly as it relates to community primary health care. I would also like to comment that, and this again is for policy issues, that the SGU is a private commercial institution. And earlier this year in February, there was the change of ownership and control of SGU. And this has to be looked at in the context of what it means for Grenada and building our national capacity, and looking at the SGU in terms of the global market. And essentially, at the global market, there's really about, a good business or real estate, real estate type of transaction. And the other thing is national health insurance. There was some mention of that as well. I just want to indicate that in early 2020, January 2020, we did host a presentation by the CHIPA consultant, but it has been in vain that we have sought to get additional information in respect of what the recommendations were, et cetera, et cetera. So thank you very much for indulging me, Mr. Moderator.
Thank you very much, Sandra. I have a little request for you, if you don't mind. Can you submit what you've just presented to us in writing, if maybe it's only in bullet point form, so we can ensure you've captured all of it?
Will do.
Okay, thanks very much. Send it to Dr. Terence Walters, just to ensure continuity of the information flow. Okay? Thanks very much. And I think this brings us to the end of a very productive day. Before I hand over to Dr. Glasgow and Dr. Walters to wrap up, let me personally thank everyone. I think we've had very constructive discussions. I have heard a lot of ideas. In fact, I'm trying to figure out how do I incorporate all these ideas into what is essentially an implementable plan, because we do not want something that goes on the shelf. So we'll have to distill it into what are the most important priorities for immediate implementation, while putting some kind of longer-term framework in place to get some of the rest of the work done. So we'll try to think it through. We have all your contacts. If we need to follow up with any of you on anything, I hope you wouldn't mind getting an email or a phone call out of the blue asking you A, B, or C, or D, depending on what happens. And it's possible we may meet again as part of the consultative process going forward, because we're feeding into the NAP, and the NAP is going to also be doing stakeholder consultations, where the health chapter will again come back on the table for discussion. So we'll see how this goes. But thanks very much, and I look forward to seeing you as we continue this process. Okay, thanks very much. Okay, so Dr. Walters, over to you.
Thank you very much, and thanks to all the stakeholders from the various organizations for being here today, for making it through the day. Yes, right, we know that we all have other things to do, but we understand that this is quite important. So we thank you. So on behalf of the Ministry of, Permanent Secretary, Jeremiah, she sends her apology for not being here this afternoon. She had some other pressing issues to attend to. So she asked me to thank you on her behalf. So on her behalf, on behalf of the Ministry of Health, Wellness and Religious Affairs, PAHO, WHO, Ms. Anthony is here representing PAHO. We want to thank everyone for your participation, your input, and we thank the consultants, Mr. Leon Charles and Dr. Lindona Telesford. So from this, we will compile the information. We will ensure that the document is updated, and we go forward. We have to do some additional consultation, I believe, to ensure that this is well prepared, all right? So like Mr. Charles said, you should hear from us. And if you have any additional things that you want, you can send us an email. For those of you who want the additional 3 documents, you let me know. Probably just give me your email, right? I have a sheet here. I'll just take your email and I'll send them off. Or probably I should just send it off to everybody, right? I'll just send the documents off to all stakeholders. All right, the list we have and the list that I sent out to last night, I'll send the information, the 3 documents, to everyone. So again, thank you very much. And I don't want to keep you too much longer than 4 o'clock. Have a good afternoon, everyone. Yes? Oh, all right, just one thing from Mr. Charles here.
Yes, just 2 quick points. One, as you see, we've recorded and live streamed the activity. So it's now available online. So you can go back and look at it, or get other colleagues who may want to be exposed to it to go back and look at it and see what it was we discussed and work from there. So that's one. 2, all rapporteurs, we need your reports to be sent into Dr. Walters. Right? So I don't know if we can get them today or we can get them by Friday. But Dr. Walters will be in touch with you to make sure we get them as soon as possible. If it's possible to get it by Friday, I'll be very happy so we can keep the momentum going. But we'll want the reports from all of the rapporteurs and or the facilitators of the various breakout groups. Thanks very much.
All right, thanks. Have a good afternoon, everyone.